Right. Good evening, everyone. The hour of 7 o'clock having arrived on this Tuesday, the 19th of May in the year 2020, I will now call to order the Common Council meeting of the City of Racine. The first item on the agenda is the Pledge of Allegiance. So if I could ask everyone to please stand, face the east, and we will say the pledge together. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, thank you very much, everyone. We could unmute Alder Tate, please. I'm sorry. If I can unmute Alder Tate. Apologies there. Alder Tate, did you have any notice of any absences for this evening?
I've received no requests for absence.
Okay, great. Then with that, what I will ask the clerk to do is to please call the roll. So I'm going to unmute everybody just for a second so we can call the roll.
To do this individually.
If you do it individually, sorry.
No, that's okay. Hold on. Alder Coe. Alder Coe. Alder Jones.
Yeah, you're doing it. What were they to see?
Oh, I can do that if you'd like.
Yeah.
Alder Santiago.
Present.
Alder Mi'kmaq.
Here.
Alder Peterson.
Here.
Alder Levy. Alder Levy.
Yes, here.
Thank you. Alder Tate.
Present.
Alder West.
Here.
Alder Land.
Here.
Alder Lemke.
Here.
Alder Taft.
Here.
Alder Young.
Here.
Alder Horton. Alderwoman Glenn. Alderwoman Glenn.
Here.
Alder Perez.
We have quorum?
We do.
Okay. The first item of business is the approval of minutes for the May the 5th, 2020 meeting. Alder Tate, would you be willing to make a motion for approval?
Move to approve.
Second.
Alder Taft, there's a motion and a second. Any discussion on the minutes? Seeing none, I'm going to unmute everybody quickly. All those in favor of the minutes for May the 5th, please say aye.
Aye. Aye. Aye.
Opposed? Motion carries. Thank you very much. The next item of business before us then are the proclamations, which I am happy to go through here today. We have two of them for this meeting that I think are both extremely timely and speak in different ways to the commitment to public service. The first proclamation, which I will read, is for National Nurses Month here in May of 2020. And, you know, we always appreciate our nurses and healthcare workers, but particularly this year in the midst of a pandemic and just watching our public health nurses here at the city do literally heroic work along with those nurses that are at our hospitals and clinics right now, keeping us all safe. So our thanks to them. I'll read the proclamation now. Whereas the 90,000 registered nurses in Wisconsin constitute Wisconsin's largest healthcare profession, that the depth and breadth of the registered nursing profession meets the different and emerging healthcare needs of the Racine population in a wide range of settings, and registered nurses are an indispensable component of the safety and quality of care of hospitalized patients as demonstrated during the COVID-19 pandemic. The Racine registered nursing workforce is meeting the challenge of the COVID-19 public health emergency by demonstrating their knowledge of science, compassion, value, and respect of every patient, their family, and coworkers. The Wisconsin Nurses Association, as the voice for registered nurses in this state, is working to chart a new course for a healthy Wisconsin that relies on increasing access to primary and preventative health care. The demand for registered nursing services will continue to increase due to the aging population, continuing expansion of life-sustaining technology, explosive growth of home health care and telehealth services, and continued presence in long-term facilities. Cost-effective, safe, and high-quality healthcare services provided by registered nurses will be an even more important component of supporting access to Racine's healthcare delivery system in the future. That along with the American Nurses Association, the Wisconsin Nurses Association has declared May as Nurses Month with the theme, Nurses Month, You Make a Difference, in a nod to their sheer numbers and the unparalleled impact nurses have on health and healthcare. The ANA and WNA extend an open invitation to hashtag Thank a Nurse for enriching our lives in the world we live in. Therefore, I, Corey Mason, Mayor, ask the Racine community to join me in honoring the registered nurses who care for us and celebrate their accomplishments and efforts during National Nurses Month, May of 2020, witnessed hereof today, to which my signature is affixed. The other memory that and proclamation that we have today is in memory of a fallen officer for the city of Racine who died in service of his community a year ago, and that's Officer John Hetland. And so we offer this proclamation as part of Peace Officers Memorial Day, and I will read it into the record now. Whereas Officer John D. Hetland was a veteran member of the Racine Police Department for 24 years, that Officer Hetland was a trusted member of the Racine Police Department, serving in numerous positions within the department, including evidence technician, field training officer, gang unit officer, member of the Greater Racine FBI Gang Task Force. Officer Hetland was a decorated member of the Racine Police Department, earning numerous awards throughout his career, including multiple exemplary officer awards, unit citations, the Award of Excellence, and the department's highest award, the Medal of Honor. Whereas Officer Hetland served as the Vice President of the Racine Police Association and the Wisconsin Professional Police Association, Officer Hetland was well regarded and respected among his peers locally and throughout the state of Wisconsin. Officer Hetland was a devoted father to his children, Hunter and Brooke, whereas Officer Hetland was the beloved son to his parents, Ron and Rochelle, and cherished sibling of his brother, Jason, and sister, Shelley. That on Monday, June 17th, 2019, Officer Hetland gave his all, making the ultimate sacrifice in the line of duty while protecting the lives of citizens of Racine. Now, therefore, I, Corey Mason, the Mayor of Racine, Wisconsin, do hereby announce and proclaim and set seal hereunto Officer Hetland to be honored and remembered on this Peace Officers Memorial Day, dated this May 15th, 2020, and a signature affixed. So it's been a big year for public servants, for the police department who lost a member, for our public health nurses who are behaving extraordinarily in these times. So I just want to thank them for that. We will now move on to the presentations. We had a presentation last time from Administrator Bowersox. We will have a presentation from her again, just in anticipation of the meeting that we have before us. We have two items on the agenda that relate to COVID tonight. One is the extension of the state of emergency as it relates to government services and the ability to apply for state and federal grants. And the other is the order from Dottie K. Bowersox, our health administrator, as it relates to large gatherings. So I do want to create the opportunity to allow for her to give her presentation, and we will hear a presentation from Dottie K. Bowersox, from Chief Howell, and from Chief Hansen, just to give us an update on where we are with the community. And then towards the end of the agenda, we will have a conversation about those additional items. Just to be clear, because there's been much confusion about this, two things that I just want to mention before I hand it off to Administrator Bowersox. Neither item on the agenda tonight is an extension of the Safer at Home order that was adopted after the Supreme Court decision came out. And there's nothing about the emergency declaration that you'll be considering tonight that extends power to the public health administrator. Her power to protect the community around public health comes directly from state statutes. So I just wanted to clarify both of those things. And with that, I will hand it over to our very capable public health administrator who will give us an update on the coronavirus here in Racine. And then what I'd like to do is, if people have questions, raise your hand, but I'm going to wait until Dottie K is finished with her presentation, and then we'll move on to both chiefs and ask people to hold their presentations until the end. Again, remember, if you do have a question, to raise your hand virtually, there's the hand-raising icon that you can use, and then we'll know that you have a question for Dottie K. So with that, Dottie K. Bowersox.
All right, thank you. Well, good evening, and thank you for this opportunity again. I sincerely appreciate it. As the mayor mentioned, he's asked me to give an update on where we are with COVID within the framework of the city of Racine. Our numbers today for the number of positives, the confirmed cases, is 716. So again, 716 confirmed cases. Of those individuals that have been tested, it's a little over 2,500. So again, we've got a little over a 24% rate of positive individuals in the city who have been confirmed with COVID-19. To put that number a little bit more into context, and to explain what's been happening over the last week, when you look at the 12th of May, we had a little over 500 cases, and again today we have a little over 700 cases. So obviously more individuals have become ill, more individuals are getting tested, but out of the entire population of the city of Racine, which is just a little under 78,000, only approximately 2,500 individuals have been tested. Within that age group, we're seeing pretty much what we've seen over the last several weeks. We had a slight increase in the 20 to 29 age group. At the same point, the 30 to the 59 age group has stayed pretty steady, 18, 19% of those overall numbers that are confirmed positive. We are still seeing a significant disparity between our African American and Hispanic populations. The Hispanic population is about 40% or almost 41% of those individuals who have tested positive, and the African American community is a little over 41%, again, of those who have tested positive. Females are still heading the ahead of males at this point. We've got almost 60% of those individuals that are positive are female. We're anticipating that has to do with caregiving capacity for most of those mothers. And testing for the city of Racine began yesterday. So the National Guard is here. They are testing downtown. Yesterday we had over 500. Today we had almost 500. So between yesterday and today, 1,000 individuals have gotten tested for COVID-19. Those test results will be back in about 48 hours. And testing will be through, testing will be through Friday of this week. We have had the opportunity, because of the demand of the citizenry, that we've added another 600 tests. So initially we had 2,000. We'll have approximately 2,600 tests for the end of this week, or by the end of this week, that'll be completed. We have 4 other testing sites that we're looking at this point between now and the middle of July. The National Guard is still available till then, but again, we've got 4 additional testing sites we're looking at this time for those individuals who would like to get tested. As the mayor mentioned, last week we had the Supreme Court decision in relationship to the Safer at Home. Decision was made at that point to pick up the Safer at Home and continue it until Tuesday of next week. So it'll be Tuesday at 8 a.m. when that goes, that does expire. At the same point, we'll be having recommendations that will be released this week on what happens, or what the recommendations from the Public Health Department are later on this week, and we'll make sure that those get distributed. We'll have media outlook or media release for the community, so they know what to expect or what to implement on Tuesday of next week. At the same time, additional order was released yesterday that has to do with setting the limits on mass gatherings. These are gatherings that require city approval or permits. Those are gatherings that, again, they would have to come to one of the different departments to ask for permission, and that order stays into effect until the end of July 31st. At that point, we'll take a look at it. We'll take a look at the metrics, the numbers, where we're at, and our hospital system, our public health system, police systems and such, and again, determine where we're at and make a recommendation if that can conclude at that point or if it would have to be extended. And this is, when we're looking at these mass gatherings, the reopening of the economy is absolutely vital, and we understand that. And we also understand that the summertime, obviously being on the lakeshore, lakefront, is in high demand, big demand. We have a lot of visitors and such. But one of the things that we're looking with COVID is to make sure that the social distancing can be maintained. So the CDC has recommended 6 foot, and it's a minimal distance. It's a guideline. At the same point, again, we know with sneezes and cough and stinging that those droplets, the COVID droplets, can disperse up to 13 feet. So when we're looking at events that are drawing, 2,000, 3,000, 5,000 individuals downtown, down at North Beach, we are very concerned about that when we're looking at the parks and the shelter opportunities. Again, having large groups of people, even small groups of people, we're very concerned about the availability to social distance and or physical distance, depending on what you would prefer at this point. So some of the information across the country that we've been receiving for several months now is that these mass events or these gatherings are very significant. Right now, it's less than 10 individuals to gather. At the same point, we've seen gatherings in church venues that, where, and one in particular, there was a choir practice, 61 individuals attended, and 86, almost 87% of them became infected with COVID. We've got a funeral where we had 100 attendees, and 25% of them were COVID, and that was down in Georgia. So I've got examples from across the nation where we've had these gatherings that have resulted in multiple individuals beyond the gathering becoming positive. So again, we're looking at this order, and so that the city of Racine does not become the epicenter of an outbreak. It's not something here that we can handle. Our public health department is stretched. We have a single hospital system that facilitates this area. We have to be concerned about their surge capacity, about their staff as well. And then obviously we have police and fire response that are involved in any of these activities that we also have to be concerned about those. So again, reopening the economy is vital, but we want to make sure that we do it in a proactive way, a healthy way, so that we can protect everyone from getting the virus.
Alder Miedema, your hand is up. The first question goes to you.
Thank you, Your Honor. Thank you, Administrator Bowersox. So I do have a question about the mass gatherings piece, because I think there's a unique, or in my mind at least, there's a unique component to this. Because if I'm reading this correctly, and you'd said it applies to issuance of permit or other permission from the city, but then it goes on to say, or planned or spontaneous events occurring on city-owned property. So in what way does this affect our zoo? Because they have obviously a wide array of different types of things that they do, which in some cases could be considered mass gatherings, but the zoo doesn't typically have to acquire permits to do a lot of these things, so they wouldn't fall under the permit thing, but then it looks like they fall under the or section. So can you talk me through a little bit about how this might impact the zoo and what we can do to help them make sure that they're able to provide as many services as they can?
Oh, yes, thank you. Those recommendations will be released later this week. That'll give a definitive perspective for the zoo.
Okay.
Okay.
Alder Peterson.
Yes, my understanding is later this week, looking at possibly Thursday for a layout as to what you're doing for the business purpose, for the business community. My concern is all the phone calls I've gotten today are in regards to emergency declaration and it being a carryover for the Safer at Home, which I understand are two different entities or two different things. It would have been nice if we would have had a layout today of what that may look like, so there'd be a little less confusion. Do you have any thought or any communications you could provide to ease people's concerns as far as opening businesses as of the 26th?
As of the 26th, yes. And again, we will release that information later this week. It will be a document that will outline all of that.
Okay. But you are planning on opening, letting businesses open on the 26th?
Well, again, that'll be within the framework of the document and that'll be explained in there.
Right, but it's hard to vote for these emergency declarations when you say there's a differentiation, but you're not confirming that businesses are going to open on the 26th.
So, I mean, just to clarify, Alder Peterson, we have before us are the two things that are noticed, the large gatherings and the emergency power extension and declaration of the public health emergency. What we don't have on the agenda or have publicly noticed for today is a discussion around safer at home. So we can have a discussion very difficultly about what is not on the agenda, but that's hard to do. And so certainly there's an understanding that people are going to want that information, and that we hope later this week to be able to lay out a plan that informs the community how we plan on responsibly opening the economy back up. But that is not noticed tonight, and that is not on the agenda for tonight. And I know that is frustrating to people, and I appreciate that, and I appreciate the confusion that has ensued between a declaration of a public health emergency to allow us to get FEMA funding and continue to do, our meetings over the internet, compared to opening up the entire economy. But that is what we have on the agenda for this evening.
Okay, thank you.
Thank you. Alder Levy?
Thank you, Your Honor. First, Administrator Bowersock, I want to personally thank you and your staff for the tremendous work that you've done over the last 2 months. It's just really incredible, the amount of effort that you and your staff have put forward. So I want to thank you for that. I had 2 constituents ask me today regarding the timing of our testing sites here in Racine versus other communities having sites open earlier. Could you speak to that? And also to my second question would be what the timeline is for when those other testing sites will be scheduled, if you have
Sure.
that timeline.
And Alderwoman, when you say earlier, do you mean that it should have been here, or it means like it should be open before 9 o'clock?
Oh, sorry. Yes, good clarification. Yes, some constituents were wondering, for example, why Burlington got to open, earlier, and other parts of the state had testing sites open earlier than May, for example.
Sure.
So could you speak to that?
Sure. Yeah. So there's a lot of variability within the testing site itself. When you request a National Guard response, there's a process that you have to go through, and there's different levels of approval that have to be met. Plus the fact there has to be the availability of the testing supplies, the personnel, as well as the laboratory that does the diagnostic test. So getting them here this week was the first opportunity that we had to do that.
Okay.
So that's for the first one. The other testing sites, at this point, we're still in conversation with the National Guard, and through that process, determine if they will approve that or not. So they've got 25 units in the state of Wisconsin deployed, but at the same point, again, you have to go through this process, and it can take a moment. So yeah.
Sure. Good.
Does that
Okay.
answer?
Thank you.
Yeah.
Yes. Thank you very much.
And Alder Levy, I would just add to that, I mean, getting through the challenge of both contact tracing and making sure we have testing that's widely available in the community remain 2 of our top concerns on a daily basis. So there's not a day that goes by that we're not trying to troubleshoot through how to get those resources here more robustly and readily, so that the community can access both of those things. So it's the right question to ask, and we just want to assure you that those are 2 of the things that we work on literally every day.
Okay. Very good. Thank
Alder Tate.
Thank you, Mr. Mayor. Several questions, and hopefully for clarity for those who have questions themselves. First is regarding the tests. How many positive tests came from the same household? I know we're doing contact tracing, so I'm curious about that.
That I cannot answer off the top of my head. That one I cannot give you. That I cannot answer. So I can take a peek on that and see if that's something that we can pull. The application that we use to keep track of everyone is a state application, and it has limitations on it and how the information that we can pull back out in a report status. So I'm not sure we can do that. So I cannot answer that question.
So I think that's important, just as people get more educated on how this virus is moving, so that they can also take the proper precautions within their own homes or how they're leaving their home. Because if the data suggests that a lot of people are getting it from people they live with, then perhaps people who are going to and from might be more cognizant of where they're going, because it's going to affect who they live with. Second question, and this relates to things later in the agenda. Will the declaration of emergency have any impact on future guidance being issued from the Public Health Department? As far as the vote tonight, would that have any effect?
No. No, the declaration of emergency through the mayor's office, again, is to ensure that there's a financial capability with grants and funding and such that come through. The public health, again, is through state statute.
I know this. I'm asking for the benefit of others, actually.
Oh, I see, yes. Yep.
Other question. The Safer at Home order that we've adopted from the Evers administration will expire on May 26th, correct?
At 8 a.m., correct.
So any orders that come subsequent would be different from that all-encompassing Safer at Home order, correct?
They will be correct.
Okay, thank you. Those are my clarifying questions. Thank you.
Alder Perez.
Thank you. Administrator Bowersox, again, thank you. I know we've had conversations about this as well. Your department's doing a great job of keeping us informed. I have a couple questions that have been brought up by my constituents and really concern me as well. One of the first ones is in your restriction on mass gatherings. It says that prior orders issued by the health department will no longer be valid. This is the newer one. Is that correct in understanding? And I'm asking that because I've had some of the churches ask me about the 25% gathering and the spacing and all those issues that we talked about. Could you clarify that for us?
Sure, yes. When we're looking at prior orders, again, we'll have recommendations. Specifically, the churches are involved in those recommendations that will be coming out or that will be implemented on Tuesday of next week.
Why the delay, Ms. Bowersox, in doing these recommendations? And that's one of the other things that my constituents are concerned with, is that they're looking at this thinking, you couldn't have told us ahead of time. You're telling us now. I've had several constituents call me with concerns about the health order because they, in fact, are losing their businesses. Two of them today announced that they wouldn't be opening because of their inability to function. And I had another constituent talk to me about suicide, and I referred them to one of our sanitarians at the city because she was really concerned that that was her only exit. What are we doing, or what can we do to minimize even waiting till next week to get better insights into these things? And I understand also that because of the orders, they're like, I have several, the church that I pastor is in Kenosha, and I've had many people say to me personally, hey, Pastor Henry, what's up with you guys? We're already all over the place, and you guys are adding restrictions, and it really doesn't make sense because in your city, they could just go across the street and go to a restaurant. They can go, and the businesses downtown are losing their places. And this is all issues that are related to these orders, and they're really heartbreaking. And how do we address those? What's a good way to address that?
Okay, so there are several questions, I think, within that one. So I'll start with the first one as far as the timeline goes. From my perspective, I think we've done well with the timeline. We had the Supreme Court decision that came down on Wednesday at 5 o'clock of last week. We had our recommendations, our orders out that evening. At the same point, the mass gatherings went out yesterday, and then we'll have the recommendations out on Thursday of this week. So the timeline, things are changing very quickly, and notifications that we receive are somewhat timely, and some of them are not. So again, if you're talking about the governor's office, the Department of Health Services, and or the CDC, At times, it does take a while for that information to get here, and then sometimes when it's here, it's not what was anticipated or what was discussed. Or we're not told at all that we're going to be receiving, whatever directive it is. So for us, again, it's a moving target. I think I've mentioned that a couple of times, I think, maybe more. But it's a moving target to try to figure out who's on first and who's on second. So the Supreme Court decision has, no one anticipated it at 5 o'clock, didn't know what it was going to look like, and then we responded to it that evening yet. So, and then obviously the mass gatherings was yesterday, and then we'll have the recommendations on Thursday of this week for the remainder of the community. So that'd be the first one. The second one is with the framework of the reopening of the economy. Yes, it is absolutely vital. The COVID-19, the pandemic has just been unforgiving, I guess would be the best way to put it at this time. At the same point, it's my position and my responsibility to ensure as much as possible that what we do and how we do it is reasonable within the framework of public health and the communicability of this disease, which is significant. COVID-19 has been estimated to be 10 times more virulent than influenza, which is significant for that. So the transmission is easy. The droplets, they hang in the air for 3 hours. They're on touch points for 72 hours. During this reopening, again, which I clearly understand is vital, there's this balance between public health and, the economy, and to get everybody moving again. At the same point, when we do this, we want to ensure that those individuals that are participating in these venues, whether it be a restaurant or a retail establishment, that they have confidence that when they go into these establishments, that there's going to be some expectation that they're going to be safe, So with the governor's order allowing 5 individuals in the retail establishments at one time, we're looking at the square footage of the churches, and that, this is how many people you can have in there. Again, because the physical or the social distancing, as well as the touch point, the cleaning opportunities, one of the largest outbreaks, that have been reported in the country came from choir and singing practice. And again, as you're singing, that 6 foot is extended for those droplets. So again, trying to balance, everything that we've got into it along with our resources. So, what is the hospital at? How many resources do they have along with the police department, the fire department, as well as the public health? And then we've got the essential workers that are out there. Those individuals that have been stocking, that have been retail, that have been working in the grocery stores, how can we protect them as well? So it's a difficult balance at best. It's not always, clear cut. And that's why within the information we'll release this week, we're hoping to have a clearer plan, a more balanced plan for individuals.
So I'm trying to understand too how, and maybe you answered this when you answered Alderman Tate's question, but at the end of our agenda today, we have restrictions on mass gatherings on your behalf. And we're, I guess because it's on the agenda, we have to vote on it. Whether we vote to pass it or not, you still have the authority to implement it. Is that correct?
I'm going to have the city attorney clarify that point for you, Alder Perez.
So by state statute 252.03, the local health officer has the authority to make any orders the local health officer deems appropriate, but she is required to inform the Common Council of what she's done. So that particular item about the mass gatherings is not on the council's agenda for its approval. It is Dottie K's, Ms. Bowersox's, fulfilling her duty to tell the Common Council what she has done. So presumably a receive and file or something like that would be the appropriate motion, but not a motion to approve or deny.
Thank you.
It's an important question, Alder Perez. Thank you. Alder Glenn.
Thank you. And thank you, Ms. Bowersox, for your presentation. I know you guys are working extremely hard at the health department. I do have 2 questions when it started, but one of my neighbors sent me another one. On your restrictions on mass gatherings that you sent out today, number 5, It says prior orders. This order is in addition to all prior orders issued, adopted, and so on and so forth. What exactly does that mean?
So that's in addition to any health orders that the public health administrators put out, specifically the adoption Wednesday evening of the provisions contained in the state's emergency order 28 as later amended. So this is in addition to whatever those orders are. However, the next sentence of that paragraph says this order supersedes all prior orders that specifically relate to mass gatherings. So if there's something inconsistent in that emergency order 28 about mass gatherings, then this one controls. But otherwise, this order is in addition to all those other orders.
Alder Glenn?
Yeah. Okay. And what's included in what are those other orders? What exactly are those other orders?
That was the public health administrator adopting the provisions that were in emergency order 28 from the state as amended by emergency orders 34 and 36. The public health administrator's order in that regard is on, is it racine-coronavirus.org? That website, so it's available. The health administrator's order and links to those other orders are all on that website. So it's a long document, but it's laid out in full there.
Alder Glenn?
Okay. Thank you for that one. Didn't really answer my question, but thank you. Mass gatherings. What is the actual number for mass gatherings? People have asked me, is it 10? Is it 50? Is it 250? What is considered a mass gathering?
Sure, yeah, and if you look at number 2 on the second page of the order, it's those planned events requiring the issuance of a permit or other permission from the city. Planned or spontaneous events occurring on city-owned property.
I think she's asking if there's a specific number.
No, there's not a specific number. I'm sorry, no, not a specific number. They need to meet that criteria.
Okay. Okay, then the last one that I just got from one of my neighbors, they had just asked me, when was the request put in for National Guard to assist in testing?
Lord, that's a good question. Trying to think of it. Last week, 2 weeks ago, I think it was. Yeah, approximately. I don't have the date on me in the paperwork, but it was approximately 2 weeks ago.
Okay, thank you. Thank you very much.
Thank you, Alder Glenn. Alder Lemke.
Thank you. I have 2 comments and 1 question. The first comment is I really appreciate all the other alders' comments and all of the information we've been getting. And I think there's, a lot of lack of clarity for people, reasonably so, just, worried about their businesses and whatnot. And I appreciate, Dottie K talking about striking the balance, and what we're considering is not an extension of the Safer at Home order. What we're considering is, whether or not Dottie K can apply for funds to get these emergency services to people that we're asking about, and to get these funds, if we want all of these services, to make sure that we have the funds and the support to do that. The second thing I just wanted to comment and just, back out and take a long view. This is a once in 100-year pandemic. Nothing has been seen like this since 1918's flu season. And, when I'm looking around the country in my role doing public health, in my day job, I'm seeing people really talking about this, being in it for a very long haul. So I appreciate what our health department is doing to try to keep people safe, and also providing guidance that allows people to continue their businesses and to continue operating, as safely as possible. And so looking at protecting people while also helping people support their businesses. I really appreciate what you're doing. And then, Dottie K, just a question. So I had seen just on my personal Facebook, people asking, am I at risk? Should I get a test? We see these the National Guard site opening up. And, I know people can always reach out to their doctor, but can you help explain for people who might be listening and thinking, man, should I go out there? Should I get a test from, the National Guard site? Who are the kinds of people, or what kinds of risks should people consider, when they're going to get a test? Who might be at risk that should get tested?
Oh, thank you, Alder. Thank you very much. It's a very good question. So again, yes, the National Guard is down at Festival Hall. They start at 9 o'clock in the morning, and they will close at 6. At the same point, depending on how many people they have in line, they may actually close down, like today was at 2 o'clock, because it would take them from 2 o'clock until 6 o'clock to actually get everybody that was already in line. I think on Monday, I think we closed at 3 o'clock, but then again, we saw over 500 individuals that day too, when their maximum is 400. At the same point, for those individuals that should get tested or might want to get tested, again, first and foremost, if you're symptomatic. I mean, if you're not feeling well, you should be at home. You should be having conversation with your primary physician. But for whatever reason, if they're not able to facilitate testing for you, this, again, you can do a drive-by or you can do a walk-up. But during the drive-by, you stay in your car. You have the National Guard individual who will come up. They will do a nasal swab. There's 2 opportunities there. At the same point, ask you some basic questions. But you'll be able to stay in your vehicle at that time. We do have walk-up there as well. But at the same point, if you're not feeling well, again, it's important to have discussion with your primary physician, but also to go through the drive-through. The other 2 venues, seeing that we're seeing a significant spike within the Hispanic and the African American community, we would ask you to get tested, even if you're feeling well, because again, 60 to 80% of individuals are non-symptomatic with this virus. So that means that you're not going to have a cough, you're not going to have a cold, you may be sick, maybe for half a day or a day, and then feel fine the rest of it. But at the same point, you can still shed the disease and you can pass it along. So that would be another population. Those individuals that, are in high-risk professions, that individuals that, are out in the community a lot, the grocery stores, individuals that are in the hospital systems. Again, those are considerations for getting tested as well for your involvement in your community interaction.
Thank you for that. I think that will help a lot of people understand if maybe they should get tested.
Thank you, Alder Lemke. Alder Horton.
Oh, thank you, Your Honor. First of all, I'd like to thank Dottie K and the Health Department for all their service and hard work. I know that it's been a lot lately. I have 2 questions. If by chance, and this is just a hypothetical, that the stay-at-home order is lifted, does that have anything to do with the rules and regulations that the hospitals have in place now? Someone is sick, you can't go visit a loved one, and is that separate from the ordinance and the things that we put in place here within the city, or does that fall up under the hospital?
No, that would be correct. That would be up to the hospital as far as visitation and interactions with any other facilities, up to the hospital.
Okay, and my second question is, thank you. My second question is also with the funeral homes. This has been a virus that has been killing almost 90,000 people in America, and some of these people have died alone. And even when they have passed away, there's only 10 people, if 10 people, that can go to a funeral. So would that pertain to? Is that the same thing that would pertain to funeral homes also?
We'll have recommendations for funeral homes that will come out this week as well.
Okay. Yep. And I just want to say, thank you guys for your leadership. There have been so many conflicting stories on a federal level to state level. And then now I hope that we can continue to lead and continue to get the right information to keep the residents of the city of Racine safe. And thank you for all that you do.
Thank you, Alder.
Thank you, Alder Horton.
Thank you.
I appreciate it very much. Alder Santiago.
Thank you, Mr. Mayor, and thank you, Dottie K. Thank you, fellow alders, for all of your questions and comments. I was going to save some of these questions for later on in the agenda, but seeing as how it's already been touched on, I think I'll go ahead and ask these now. obviously, there's been a lot of kind of uproar on social media. I'm sure you guys have all been receiving calls and concerns from constituents. I've been in contact with constituents and business owners the better part of the day today. So just to bring some clarification, on behalf of some of the constituents, I'd like to ask, what are some of the specific programs and grants that you foresee the city directly benefiting from by extending the declaration of emergency?
So certainly FEMA funding requires a state of emergency. That's first and foremost. So an example separate from COVID earlier this year when we had the big storm on Lake Michigan that really ravaged the lakefront in January there, we had to have a declared state of emergency to have FEMA even consider those funds. And then there's obviously state funding that's come through with the CARES Act and some of the other funding sources that have come through state and federal resources. Some of them require it, some of it don't, but it's better to have those resources in place to access those resources quickly and get them into the field than, you know, to not be able to have it in place to be able to do it. And it's also, just to be clear, it's not just, you know, state and federal grant money that it allows us to access. It's also being intentional about, you know, City Hall and our interaction with the public, continuing to do meetings as we are now over the internet on Dottie K's advice. It's those city operations that the declaration of emergency really gets at, along with our ability to interact with other units of government to get resources, be that, you know, the work we're doing with the National Guard or the ability to access FEMA funds or other state and federal funding that may be contingent upon that declaration.
Okay.
Dottie K, anything you want to add there?
Nope, that was good.
Okay, so it's more of a matter of a time saver kind of thing. Just keep the ball rolling.
I wouldn't just say it's a time saver, right? It's also if you don't have the declaration, in some cases you can't even apply, right? And so it's really an important consideration to be able to have those considerations, particularly with FEMA. It's the first question, well, maybe not the very first question, but it's one of the first questions they will ask is, well, when did you declare your emergency, for what period of time? And so with the pandemic, it's a little bit different because, like, you know, with the lakefront, there was a storm that lasted 3 days, right? And so we were able to say for these 3 days, you know, the damage that was done to the lakefront is what we want to talk about, right? The pandemic's a little bit different, and I think everybody's trying to figure out how best to apply these kind of rules of engagement with the federal government. But nonetheless, it's better to have those things in place to be able to access those things and not have them in place and miss an opportunity for funding to get our community back up and running and the resources it needs to stay safe.
Okay, thank you. I guess one other question. Just to ease some people, I believe a lot of business owners are really afraid at this point that we're going to have another safer at home declaration. Is it true to say that only the public health administrator, Dottie K, is capable of issuing that and not the mayor's office?
That is correct.
Okay.
I'll let the city attorney, if people want him to verify what state statute says.
Well, yeah, the best answer is what you said is correct, yes. The local health administrator is the one with that authority.
Okay. I think that's all I have. Thank you.
Thank you, Alder Santiago. Alder Perez, is your hand up for a second time, or is it? Okay,
yes, sir.
Go ahead, Alder Perez.
Thank you. Ms. Sparsox, I have some friends who are Hispanic, and you said that's a critical point, but they're also undocumented, and they're afraid to get tested. What kind of questions are being asked, and how can we get testing to them?
Yeah, and they can go to Festival Hall and get tested. So the basic information is going to be an address, name, address, and telephone number, so that the guard is responding to individuals, letting them know the negative, and the health department is doing the positive. They also need to have that information to go through the diagnostic part for the specimen, and that's all.
So are they going to need identification to do that, or can they just verbally say who they are?
They can verbally say who they are.
Okay, so on our advertisement, it says that everyone can come to Festival Hall, I border Mount Pleasant, and I've had questions from folks in Mount Pleasant saying, because I'm not a city resident, can I also go and get tested at Festival Hall?
Yes, they can.
Okay. And is there, by way of your order from the health officer, this has been touched on, but I'm not sure I understand it. Is there some monies that come from other sources because of your order?
No,
Here's the reason I'm asking. You know, in your order that restricts mass gatherings, it says whereas. Now the mayor has talked about it, Alder Santiago has talked about it, and some others about funding. And so is there something related to funding that comes with your particular order this time?
not for my order, no.
Okay, so all the discussions we've had on funding on this then is no?
Alder Perez, there's two items on the agenda. The emergency declaration from my office is what facilitates the additional funding. Dottie K, correct me if I'm wrong, but there's nothing about your order around mass gatherings that would impact funding one way or the other.
No.
Okay. And this one's for the city attorney, please. So the order we're going to vote on is he recommended a receive and file, which would make sense. During that process, is there an ability to object to that order?
As far as the health officer's order, I suppose you can state an objection, but she is just required to inform the Common Council of the orders that she has imposed. So there really isn't something formally for the Common Council to approve, disapprove, or formally object to. Now, the extension of the emergency declaration, the other item, of course, the council will vote on. That's a different issue.
Okay, thank you.
And Alder Tate, you have your hand up as well.
Yes, I do. Thank you. So first, I'm curious as to how the eventual rollout of reopening will be communicated thoroughly and effectively and broadly to our business community.
Oh, thank you, Alder. Yes. So that information, we will be holding a press conference, and we have a lengthy list, email addresses of establishments that will be sent to.
Okay.
Organizations and establishments, I should say.
Okay, good. I kind of want to go back a little bit to the what the city attorney was addressing as it relates to the in addition to piece. So are there portions that your yesterday's order are in addition to that have effectively sunset dates?
Well, the mass gathering order goes to July 31st.
Right.
The prior order, by its own terms, expires on May 26th. So it does to that extent, yes.
Okay, great. That is an excellent clarifier. So portions of the existing public health orders internally have expiration dates, and that is when those orders will end, regardless of what happens tonight, regardless of what future orders may come. There are portions that currently are in place that have an expiration date. That's good to know. So kind of what I'm seeing today, and what I think all of us are seeing, is exactly what, the state governor said was going to happen, that we're seeing chaos occur in terms of each municipality having to try and navigate this separately and make up their own plans of how to safely, re-engage our economy, allow businesses to open, and keep communities safe. I'm curious to know at which point local public health officials started developing a plan to reopen, considering that we had state government working on those plans prior to the Supreme Court's decision.
Yeah, that's a good question, Alder. Thank you. Each jurisdiction has been in a different framework for when they started on the plan or what their plan is. The plans have changed frequently. It's a moving target. Plans have changed frequently for jurisdictions in the Southeast region as well as the rest of the state. So I don't have like an exact date on when it was started or, you know, whatever, but I can just tell you that even as of this afternoon, you know, things are changing very quickly.
So what are some of the gating criteria or data that you'll be taking into account as you offer guidance to businesses?
Sure. So we'll be looking at the availability of personal protective equipment for emergency responders. We're going to be looking at the hospital surge capacity. We'll be looking at how many of the hospital personnel have been affected with COVID-19. We'll be looking at the public health response. We'll also be looking at the numbers. So we'll want to know, you know, if we've seen a flattening of the curve or if we've seen a downtrend of the numbers, which will be very important. And then we'll also be looking at the number of individuals who've been tested and the availability of testing.
Okay, great. And are there specific metrics? I'm not asking that you state what they are tonight, but are there specific metrics that you're looking at to kind of identify at which point certain activities can take place?
Yes.
Okay, great, thank you. And then my last question is not so much for you, but to my Common Council colleagues as we progress into the agenda. We're discussing, you know, on our agenda tonight, the thing that we will vote on, yay or nay, is the emergency declaration. The question you really ought to be asking yourselves between now and when we get to that point in the conversation is, are we actually facing an emergency right now with COVID-19? If you think the answer is no, go ahead and vote no against an emergency declaration. There's no emergency, it's all fake, nothing's real. But if you think we're actually in an emergency, then we know how to vote on this declaration later on. And with that, I'll conclude. Thank you.
Thank you, Alder Tate. Alder Toe.
Yeah, I've gotten tons of calls, yes, all day yesterday and all day today. I want to know why we have to vote on this thing before there's any specifics that we can let our business owners know that, yes, you're going to be able to open. I understand what's trying to be done here, but I don't have an answer for them. I can't guarantee them that if we vote this, that we're not going to just extend this thing.
Yeah, and Alder, could you clarify on the vote? Because the vote for tonight is the emergency declaration from the mayor's office, which does not have to do with the extent of any orders. So I'm just a little confused.
Okay, well, that's what the question's been asking me all day. People are concerned that if we vote on this, that their businesses are never going to be open, and I'm just trying to let people know that, you know, clarify what it is.
Yeah, and the emergency declaration from the mayor's office is not connected with the Safer at Home. There's no connection between the two of them.
All right, then. Like I said, people are just concerned, wondering why we couldn't have something out there now if businesses are supposed to open in a week, why we got to wait till Thursday and we're voting on this other stuff tonight.
I understand, and we're working as fast as we can. And again, things are changing, and we want to make sure we take everything into consideration. But we're working as fast as we can.
All right, thank you.
Alder Glenn.
Thank you again. I just got another text message from one of my neighbors in my district. So the Safer at Home will expire on the 26th, May 26th.
8 a.m.
At 8 a.m. It expires. Okay, I'm just asking them and making sure that is correct. Thank you.
Alder Perez.
Thank you, Your Honor. So, Dottie, you said there was no relationship between your order and the mayor's order, but does your order have to be an antecedent to his order or anything to that effect?
I'm sorry, I kind of lost you a little bit.
Can you repeat your question, Alder
Yeah,
Perez?
we kind of lost you a little bit.
Yeah, no problem. There are two different, you have an order and the mayor has a resolution. And you said there was no relationship between the two. But does one have to be issued in order for the other one to also be issued, or are they totally independent of each other?
Independent.
Okay, so there's no antecedent in that you had to do yours before the mayor could do his.
No.
Okay, thank you very much. That's all.
Okay. With that, I think we've exhausted all our questions. Alder Coe, your hand is still up. Did you just neglect to put it back down, or did you have another question?
I thought I put it back down.
Okay, great. Well, with that, I do want to thank Dottie K. Bowersox for her presentation tonight. Just to be clear, she has been working almost literally around the clock for weeks on end without a break, as have a lot of the public health staff. We are a small but plucky department that has been doing really amazing work to do the very best that we can to try to contain and mitigate the spread of this deadly virus throughout our community. And so she deserves our thanks, as does her entire department.
Yeah.
So thank you. With that, I want to hand it over to Chief Hansen and ask him to give a bit of a presentation here about what the fire department has been seeing, particularly with our paramedics who are transporting people to the hospital who may ultimately test positive for the coronavirus. Chief?
Mayor Mason, members of the Common Council, thank you for the opportunity to allow us to update you on what's going on in the fire department. Planning for this pandemic started almost 11 years ago when we first experienced the N1 or the H1N1 virus, which was known as the swine flu. We started stockpiling supplies. We started putting together policies and procedures to deal with pandemic issues. And up to this point, those plans are now starting to come to fruition and are assisting us greatly in dealing with the COVID-19 pandemic. The pandemic really took off around March 1st, and shortly thereafter, we started implementing this policy and plan to protect the firefighters and paramedics against catching this COVID-19 virus. So well before the virus even hit Racine on what would be March 18th when we had our first 2 cases, we were already implementing protective measures with our employees, including the wearing of face masks. We always wear gloves. We have gowns available. And then we started screening people for unusual symptoms such as the fever, the cough, and shortness of breath, and making sure we take extra precautions with those patients. On March, you have this agenda before you, the update before you, so I'm not going to read it all line for line, but on March 13th, we started additional protective measures for our members, including the suspension of fire inspections, the suspension of the fire safety program. Of course, the schools are closed down, so the students aren't there. The mobile integrated health program was suspended as well. We were doing home visits with various community members, although we are still making telephone calls and following up with those folks. We switched our training to what's called our Polycom closed circuit TV system. So we were in the middle of our emergency medical technician training program, refresher, and we needed to complete that, so we were able to do that using remote learning over the Polycom closed circuit. And then we also did an inventory of our supplies and projections on what those the usage or what's called the burn rate would look like at that time. We also put contingency plans in place in the event that we wound up being short-staffed. As many of you are well aware, some of the hardest hit areas of the country, such as New York City and Boston and those areas, were suffering from, and still are suffering from, critical shortages of paramedics and EMTs because of the infections that were running rampant there. We have a plan in place in the event that that happens here, and I'm happy to report this evening that has not happened. So we haven't done anything with that. Our members are all healthy and well at this time. On March 16th, we suspended what's known as the First Responder Program. Although our paramedic units can still request additional assistance on all emergency calls, that was to minimize the number of fire department members that are exposed to patients. Again, recognizing that this was going to be a pandemic that was going to be of epic proportions. A couple days later, we had our first 2 cases of COVID-19 transported to the hospital. Since that time, the number of cases has risen. The fire department has transported many COVID positive patients to the hospital for treatment. I'm proud to report that all our firefighters and paramedics are wearing their proper personal protective equipment, including the masks, the gowns, the shoe covers, Tyvek suits that we provided for them, so that they are in good shape to this day. As we look down, we've been ordering additional PPE supplies. We've been working with the county on getting the appropriate number of supplies shipped to us. That has been a little bit of a challenge, but at this time, we have adequate stocks of personal protective equipment. One of the other things we did is we picked up a 55-gallon drum of hand sanitizer, which we have distributed to various city departments in spray bottles for hands and the surfaces, decontaminating surfaces. Let's see, on April 23rd, so you heard Dottie Kay talk about the contact tracing that her department is doing. On April 23rd, our Fire Prevention Bureau, 5 of our members, including the Division Chief of Fire Prevention, have been helping the Health Department with their contact tracing. This is making phone calls and trying to follow up on people who may have been in contact with infected people. This is done from the confines of the Health Department. There are no home visits involved in this. So they've been doing a great job with the Health Department as another city department to help them out as we move forward through this pandemic. One other thing that I would like to mention at this time, we did, somebody had mentioned earlier about grants. The fire department, through the Assistance to Firefighters Grant supplemental grant process, has applied for grant funding to purchase additional PPE. You will be seeing that come up at the Finance Committee meeting when they next meet, and then eventually it'll come before the council. But that grant is going to be at about $68,000 for additional personal protective equipment to help us get through this year and early next year. When we look at call volume for the fire department, something interesting has kind of happened, and there is a reason for this, is our call volume has actually decreased by over 8.5%. It's gone down from last year during the same time period. What we're seeing, and I'm sure many of you have seen this on the news, is that a lot of folks are not calling 911, opting not to go to the hospital for fear of catching COVID-19 at the hospital. We've been in constant contact with the hospitals. They have very good infection control policies and procedures in place. And in my estimation, it's probably one of the safer places to be during this pandemic. The hospital is not running at capacity. We check with them on a weekly basis. Their ICU unit, emergency room, and then obviously their beds on the floor have not been at capacity, and we closely monitor that situation. So again, our call volume, our overall call volume, is down almost 8.5% from the same time period last year. At the present time, the fire department is operating normally. We don't have any shortages or issues that are of concern to us. Ascension has had a slight increase in emergency room visits and admissions, but again, still well within their capacity right now. But again, looking down the road, we need to be careful that if this epidemic does take off again, that that hospital could fill up very quickly. In the event that were to happen, we do have contingency plans to move patients to other hospitals within the area if that's required of us. With that, does anybody have any questions?
Any questions for the chief, Alder Perez?
Thank you, Your Honor. I know the fire department, Chief Hanson, the fire department has a different schedule where they're on and off, and the police department went to different schedules themselves because of this. Have you had to make any adjustments to the schedule of firefighters?
Alderman Perez, thank you for the question. No, we have not changed our work schedule. Inherently, during the course of a 9-day work cycle, firefighters do have a number of days off in between there, so we have not changed the schedule at this point. Something that I should also mention is that every day when the firefighters do come in, we do check their temperature and do the questioning twice a day when they come on shift at 7 in the morning and again at 7 p.m. in the evening, just to make sure that they ensure their health. But no, we have not needed to change our schedule at this time.
Has this affected your overtime budget in that it has not used it as much?
Overtime budget, I just checked it this morning, is running about normal, what we expect. We haven't seen any spikes in the overtime budget at this point.
And you did say that none of our firefighters have yet to be affected?
Up to this point, no, that is correct. No firefighters have been impacted.
Well, thank you for all the hard work you guys do. Community can't survive without first responders, and we really appreciate it.
Thank you.
Thanks, Alder Perez. Alder Coe, is your hand still up from before, or did you have a question for?
I thought I took it down a long time ago.
No, it's still up there. So,
take it down.
All right. Seeing no other questions for Chief Hanson, thank you very much for your time, sir. Chief Hall, you're up.
Thank you, Mr. Mayor.
Thank you.
Honorable members of the Common Council, good evening. I'd have a few prepared comments and then I'll, of course, open it up for questions. Before we get into my formal comments, I would be remiss if I did not acknowledge the loss to our city and the loss of Officer Hetland. Last week was, of course, National Police Week, as designated by President Kennedy in 1962. And so I would like to just bring the council up to speed relative to some of the events that took place last week because they are significant. Officer Hetland's name was added to the police memorial in Madison, and normally there would be a large ceremony to acknowledge as much. However, due to the restrictions on gatherings, the Hetland family and a small group of officers went up to honor his sacrifice and to commemorate the addition of his name to that wall. Also, during the course of the past week, Officer Hetland's name was added to the National Memorial in Washington, D.C., and we had a candlelight ceremony last week to acknowledge that virtually as well. Thanks to the Hetland family, they have decided to postpone our local ceremony until such a time when all of the officers and all members of the community can be at Hansel Park here in Racine, where Officer Hetland's name will be added to that memorial. And so I'd like to thank Mayor Mason, members of the council for their leadership in acknowledging May 15th as National Peace Officers Day, and the proclamation was appropriate, and also the Hetland family was presented with a special gift commemorating the enormous sacrifice to that family and to this community. So thank everyone for all the support to the department during the course of the past 10 months. Moving forward, my job tonight is I would like to, before we get into any type of enforcement activity, I'd like to try to provide some information, context, education, if you will. I'd like to enlighten the council, and then we'll talk a little bit about, we want to encourage compliance, and then we'll get into enforcement if that becomes necessary. So for clarity, there were 4 orders that I'd just like to focus on, because as I listened to the discussion, and there's phenomenal questions, and I hope we can answer everybody's questions, but I think for context, I just want to start with recapping the 4 orders that I think could cause the most confusion, and then I think if we could bring some clarity to that, I think we could have a more robust conversation. Most people are familiar with emergency order number 28. That's the original Safer at Home order. It was originally issued from March 25th through April 24th, subsequently extended through May 26th. We know about the Supreme Court's decision relative to that. The second order, I think that doesn't get as much attention but should, is emergency order number 31. That's the Badger Bounce Back Plan. This order was issued to turn the dial down on the Safer at Home initiative, or Safer at Home order. So here was the objective of state leaders to make known the core public health responsibilities that must be satisfied so that the state could move forward with less restriction. Then there's Emergency Order 34, again, expanding the order to turn the dial. And so there, if you read those orders, you'll find that that's where businesses were allowed to open again, curbside service and things of that nature. And so the inference that somehow business was being choked out by these orders is exactly not the case if you actually read the orders. And then the last order, emergency order number 36, again, expanding on turning the dial. This allowed additional minimum basic operations for businesses. And so the whole objective, obviously, in the middle of a pandemic is to keep people safe and also safeguard the economy as well, but you won't have much of an economy if everybody's dead. So if you look at the orders, it's pretty self-explanatory. Depending upon who you talk to, it could be like Rubik's Cube, and it could be really confusing, or you could just read the orders, and then it becomes less confusing. From an enforcement standpoint, most of you know that our local ordinances adopt state statutes. And so state statute 252.25, that's adopted by ordinance 22-424. That's a citation in the amount of $565. That's a citation that the Racine Police Department can issue if there's violations of the orders that we have discussed. When will we issue those citations? It's not something that happens on a regular basis. It has happened once. The overwhelming majority of the calls that we go on, we basically inform. And we do so with the objective to gain compliance. And it's only when we don't gain compliance that we resort to enforcement. Also, on that note, if there's a liquor license that's attached to any type of a violation, then there's ordinance 22-422 that could be implemented as well. And so, so that's just kind of a quick snapshot of the orders that are in place and the ways that they can be enforced. Now, I'm going to talk a little bit about what happens in the community and what happens in the business community, because there's separate dynamics there. Over the weekend, we had kind of an unusual disturbance at the neighborhood level that required that we call quite a few officers to deal with. I would actually like to share video with you all of this particular event for two reasons. One, just to illustrate how senseless it was. And two, we're looking at posting it online so that parents and relatives and folks who maybe loan their friends their cars could see what happened that night, because we were pretty close to blocking the area off and just towing everybody's car, and then they could come and explain to us later why there was like 50 cars in a residential neighborhood at 10 o'clock at night in the middle of a pandemic. And so the objective of the discussion tonight is to hopefully not have that happen again. We have Memorial Day coming up. A lot of families are going to want to get together, and certainly if they can do that in a healthy manner, in a safe manner, in a respectful manner so that they're not disrupting the rest of the neighborhood, certainly we will want to encourage that. But we also have to be mindful that, as was shared earlier, I mean, when people are not responsible, they basically just become carriers to infect other people. And so as a component of my role as the public safety leader, I have to make sure that we're doing things that are safe. Alder Perez, you had two questions that I think I should weigh in on. Excellent questions. The question relative to testing for people that are undocumented. I'm sure, Alder Perez, you're familiar with police policy relative to the laws that pertain to kind of when you're dealing with undocumented folks that have information to share with the police. There's provisions that allow us to basically work with members of the undocumented community without the fear of incarceration. So those, the U visa system is in place, alive and well in the city. And so when there's occasions where we can be assisted in a public safety sense from members of the undocumented community, they can work with us without fear of any type of arrest. But to give you a more real world example, Alder Perez, if I show up at the hospital or any other officer and there's an undocumented person who is receiving treatment, I don't have the authority without a search warrant or without some kind of probable cause to start asking questions relative to that person's status. And it would be no different at Festival Hall. The Constitution and all the rules of engagement relative to search and seizure, they would apply. So the scenario that you bring up for the lakefront would be no different than any other place in the city. I'd still have to follow the rules. And so it's a great question, but it's a question that I'm happy to say nobody's rights would be violated relative to that. The other question, Alderman Perez, that you raised was the overtime question. and the question about police and fire special schedules. We did put our people on a special schedule in order to mitigate what happened in New York, Detroit, New Orleans, and other police departments that were just completely decimated. As we know, this COVID-19 virus can lay dormant, and a person can be infected and asymptomatic and infect their coworkers, and that has happened. And so our emergency schedule put us in a much better position to not have that happen. And it wasn't designed to save money on overtime, but the net effect was that it did, because we have less officers in the field, because they're under strategic quarantine, and so therefore we did save money on overtime, but that was not the goal. The goal was to keep our members safe. So those are my prepared comments, and I'll open it up for questions.
Alder Perez, I see that you have a question. Yes?
Yes, sir. Thank you. Chief, how's the mental health of the officers having to deal with this? I forgot to ask Chief Hansen, but that was one of my concerns as well. Is, we last year approved some extra funding for mental health concerns, and just their tough schedule and not knowing the unknown, it's got to be weighing heavily on them. How are we doing there?
So great question. Today I spoke with our in-house therapist, and unfortunately we have that resource available, and so that has worked out really well. It's ironic that you would ask the question today. We had a meeting earlier today where we're going to be looking to work with other departments so that we can expand those services, so that it's not just the City of Racine Police Department that has access to the mental health professionals, but we could expand that to the Racine County Sheriff's Department, Sturtevant, Mount Pleasant, Caledonia, and other surrounding jurisdictions.
So,
go ahead, Alder Perez.
Thank you, Your Honor. Chief, I selfishly want you to consider that we prioritize our people first. I know it's important that we share our resources and maybe come into a mutual aid or mutual financial aid contract with them to be able to do that. But really concerned for our officers here in the city, being the biggest responding units to everything that goes on, and really concerned that they're being taken care of. So as you move forward with this, please, show them and tell them of our support, and really keep them at the forefront of this mental health issue.
Much appreciated, sir.
Well said, Alder Perez. Alder Tate.
Thank you. First, Chief, thank you for your leadership and a measured, rational voice during this time, especially from a law enforcement perspective during this time of confusion and crisis. I am curious for you to kind of describe the impact of officers, engaging in enforcement and their potential exposure, as well as what sort of risk they would be exposed to in the event of, mass gatherings happening, as the public health administrator has put orders out for those not to occur.
So that's a great question. Clearly, what we've tried to do two things to keep our members safe, right? So the first thing we did earlier, we implemented an online reporting system where we have lower priority calls for service that don't necessarily require an officer to be physically present. We're doing a lot of those calls for service online. We've also instituted phone reporting where calls, if an officer needs to give specific advice, and you do actually need an officer's feedback, but you don't need the officer's physical presence to recover evidence or anything of that nature, we're doing more phone reporting. And so certainly, anytime an officer has to engage with anyone in the community, especially if the officer has to be involved in any type of hands-on enforcement where there's going to be an arrest made, the officer is simply exposed. And there's no cure for that, right? We can wear masks, we can do things to mitigate the risk, but if you have to come into close contact with someone, the officers are definitely at risk. And that's why we put together this emergency schedule that basically took the officers out of the field for 18 days every work cycle. Now, they would be on call for a portion of that time, but if all goes well and we didn't have any major events, then they could stay in this quarantine period and basically be away from exposure opportunities. But the people that are working, We've done everything we could do to mitigate their exposure, but there are times where they have to basically engage with the public. Now, that's why the event that happened over the weekend was so frustrating, because we've been extremely successful with our emergency schedule, and then to give it all back potentially because someone wants to have an outrageous party is just it's just unnerving, right? So that's why I'm going to actually share the video from this weekend with you all, with the hopes that you'll share it with your friends, families, anyone you have influence over, because what we're going to be looking to do is just basically educate everybody before I have to enforce this at a higher level.
Thank you. I guess, you know, part of the reason for my question is I think it's important that people hear from a public safety perspective, because a lot of the COVID crisis has been about public health. And Dottie K has done a fantastic job of trying to get that information out and manage it with limited resources. But also there is a public safety aspect of this. And as much support as people will expound on supporting law enforcement, you know, there are certain steps that, you know, orders such as Dottie K's are to reduce the risk and exposure of law enforcement, particularly for events that require, you know, closing city streets or require, you know, officers to be on hand to manage those crowds. I'd like you to be able to speak to that a little bit so people can understand that these orders don't just affect, you know, individuals, but it also affects those who we see as, you know, heroes in our community and reducing their potential risk to this virus.
Sure. So a couple different points on that. A simple Google search for New York Police Department, Detroit Police Department, New Orleans Police Department. These are police departments that at one time there was about a fifth of the New York Police Department that was either out sick or under quarantine. Just imagine what public safety would look like if you take away that many officers that cannot come to work on call. They're required to stay away from work. And so just a quick search will give you an idea of how quickly public safety can be impacted. Also, if you visit the Officer Down Memorial page, you will see the rising death toll amongst frontline public safety workers. It's tragic enough that officers sacrifice their life in the line of duty under circumstances which we generally have no control over. To lose officers under circumstances that we could mitigate by our conduct is unacceptable.
Thank you, Chief. That's all I have. Again, thank you, Chief Howell, Chief Hansen, Dottie K, for all that you're doing to address public health and public safety. You are the front line. We're just grateful for your service.
Any other questions? Alder Horton.
I just want to say, Chief, thank you for your leadership and basically the memorial for Officer Hedlund and being able to, you know, being able to give him his just desert, and for the family, we continue our prayers. I'm not going to go too far into this, Chief, because this video is probably what I really want to hear and see. Because I sit on a committee, a gang task force down in Kenosha, and I've been hearing of numerous parties down in Kenosha, racing, young people out partying, and mass amount of people that has disregarded the public gathering ordinances. And we have all these cases, but the reality of it is that we have some people that are disregarding the entire issue of us being in a pandemic. So what are you guys? I know the COP houses are closed. What are you hearing out there, Chief? Is things moving? Are things a little skeptical out there when it comes to just crime and people disobeying the order?
So it's a little mixed, Alder Horton. Certainly I would be remiss if I did not acknowledge the people who are following the order, because there are days where our officers are not required to engage in a great deal of activity and disorder, but then there's other days where you would not know that there's a pandemic going on. And so as the objective of my comments tonight, as we get closer to the warmer months, obviously Memorial Day, unofficial beginning of summer, people are going to be a little restless. What we want to do is provide enough space for families to fellowship and businesses to conduct business without us overly exposing our community to greater harm. We know what the data tells us relative to what's going on in the greater Racine community, and so we want to be very intentional about how we proceed in the days and weeks to come, because the decisions we make today are going to have a significant impact on what happens tomorrow. And so, yeah, we had this one event over the weekend, and I'll share the video with you. There, you can readily identify faces. I want basically every grandmother, aunt, uncle, cousin in Racine to watch this video. And if you have loved ones that you care about, pull them aside and explain to them that, hey, what you were doing was wrong. B, don't come to my house anymore if you're going to be out there like that.
All right, Chief. Thanks a lot again. Thank you for your leadership, and thank you for what the department has done for the city. Thank you.
Thank you.
Thank you, Alder Horton. Alder Young.
Thank you, Mr. Mayor. Thank you for the work that you do. I've been reading articles from across the country regarding a rise in domestic violence. And I know that the Racine Police Department announced Thursday, April 30th, after receiving the COVID-19 Community Response Fund grant to work to mitigate domestic violence. I was just wondering if we could receive an update regarding how the police department is addressing such an important issue in our community.
Sure. So fortunately for Racine, the data it did not support the national trend. However, that was not a reason for us to rest on our laurels. So hats off to Vicki Selko, Liz Powell from the Racine Community Foundation, Allie Haig from United Way, Pam Handrell from Bethany Apartments. All of these local leaders partnered with us a few weeks back to apply for the grant under the COVID fund. And the result of that was we were able to put together hotel vouchers for people in crisis before it elevated to violence. And for the first time this past weekend, we were able to place a family through this fund. And so even though the data at this point does not suggest an increase in violence, that could change at any moment. And we were prepared to act on a moment's notice when we learned of a situation over the weekend.
Thank you, Chief. I appreciate your department modeling community partnership and being proactive. So thank you.
Thank you, Alder Young. I do just want to echo something that, we often get, as we're thinking of fallen officers and those celebrated this week, and often in many times of crisis, people often ask, well, what can we do to support first responders? What can we do to show our support for police and fire? And honestly, I can't convey this for all those people saying, I want to open up tomorrow and I don't care what the consequences are, I just want to remind people that it's first responders that are taking those individuals to the hospital, that it's nurses that are at the hospital, that are there every day, that are caring for those people. So if you want to do something to show your support for first responders and healthcare workers, please follow the public health guidelines that are out there to help mitigate the spread of coronavirus. It's honestly the best thing that you can do to show your support. And I would plead with not just the council, but anybody in the public who's listening, who's ever, posed the question what they can do to show support for first responders. The best thing that you can do is actually follow the guidelines to keep us all safe. So with that actually exhausts the presentations that we had for today's meetings. The public comments on the agenda have been emailed to all of you from the clerk's office, so you should have those. Please know that those will be added to the official minutes of the meeting moving forward. Now let's just move on to the committee reports. And the first committee that is up is Finance and Personnel. Alder Tate, do you have any items for separate consideration? Oh, I'm sorry, Alder Taft, not Alder Tate, Alder Taft. Any items for separate consideration?
I have received no such request at this time.
Okay, please proceed with the report.
Okay. Item 215-20, communication sponsored by the chair on behalf of the city attorney's office, submitting the claim of Daryl Johnson for consideration for disallowance. The recommendation of the Finance and Personnel Committee was that the claim of Daryl Johnson be disallowed. Fiscal note not applicable.
Alder Young, did you want that item for separate consideration?
Oh, no, I'm sorry. I forgot to lower my hand.
Oh, I'm sorry. Alder Taft, please proceed.
Okay. Item 248-20, communication sponsored by the chair, submitting amendments to the household hazardous waste agreements to reflect 2020 approval charges. 2020 approved charges. Recommendation of the committee is that the mayor and the city clerk be authorized to sign amendments to the household hazardous waste agreement with participating surrounding municipalities. Fiscal note, the household hazardous waste rate has changed from $4.40 to $3 for 2020. Next up, item 260-20. Communication sponsored by the chair requesting that the Finance and Personnel Committee determine the day of the week and hour at which it will meet for the next year. Recommendation is that the Finance and Personnel Committee will meet at 5:30 p.m. on the Mondays following the regularly scheduled Common Council meeting, and that the Monday, May 25th, 2020 Finance and Personnel Committee meeting be moved to Wednesday, May 27th, 2020 in observance of Memorial Day. No fiscal note. Communication, item 265-20, communication sponsored by Mayor Mason to gain authorization and approval for the city of Racine to join with its partner agencies, Racine County and Racine Unified School District, in selecting and awarding a 3-year contract for the comprehensive operation of a health clinic at 2333 Northwestern Avenue in the city of Racine, serving the employees, retirees, and covered dependents of the 3 partner agencies to Ascension, Wisconsin at work at yearly cost of $1,446,453 for year 1, $1,557,279 for year 2, and $1,666,245 for year 3, with the city of Racine responsible for 26% of said contractual costs. Further, that the mayor and city clerk be authorized to execute on behalf of the city. The recommendation of the Finance and Personnel Committee is to approve the request by the mayor, as just read. Fiscal note, the full yearly cost of the Ascension contract is $1,446,450. These are big numbers. $1,446,453 for year 1. $1,557,279 for year 2, and $1,667,243 for year 3. The city of Racine is obligated to cover 26% of these costs, or $376,078 for year 1, $404,893 for year 2, and $433,483 for year 3. The cumulative cost to the city is $1,214,454. The approved budget for fiscal year 2020 is $384,000. So cost to the city from HealthStat for fiscal year 2019 was $376,824.44. In their proposal, respondent contractors were required to calculate the expected return on investment for the consortium members based upon expected average utilization. Ascension indicated that the city, based upon clinic revenues and direct and indirect cost avoidance, would receive a return on investment of $316,758 in year 1, $441,913 in year 2, and $544,851 in year 3, or a total of $1,303,522 cumulatively for the 3 years, which is compared to the total cost of the city for these 3 years of $1,214,454. All right. Next item. 267-20. Communication sponsored by the chair on behalf of Chief Howell, requesting to appear before a common council to discuss applying for and accepting the 2021 Bulletproof Vest Partnership Grant. Recommendation of the Finance and Personnel Committee is to approve applying for and accepting this grant. The grant is in the amount of $46,575 with a requested city match of $46,575 from the Racine Police General Fund. This grant will reimburse 50% of the cost of vests in 2021. Next item is 268-20, communication sponsored by the chair on behalf of Chief Howell, requesting to appear before the Common Council to discuss applying for and accepting the 2020 Coronavirus Emergency Supplemental Fund Grant. Recommendation is to approve applying for and accepting the 2020 Coronavirus Emergency Supplemental Fund Grant. Fiscal note, the grant is in the amount of $129,955. No city match is required. Next item is 269-20, communication sponsored by the chair on behalf of the city clerk, submitting the bid received for printing the Common Council proceedings and legal notices for the period of June 1st, 2020 through May 31st, 2021. Recommendation of the Finance and Personnel Committee is to award the bid to the Journal-Times, they being the sole and lowest responsible bidder. Prices, fiscal note prices have increased for published advertisements to 46 cents per line for the first insertion, 45 cents per line for each subsequent insertion, affidavit fee of $1, 3 copies of each session of the Common Council for $15.50 per page, and bound books for $67.25 per page. That concludes the report of the Finance and Personnel Committee. I also want to reiterate my thanks to the chiefs and to the public health administrator and all the city staff for all the hard work that they're doing. Thank you very much.
Thank you very much. Without objection, these items will be placed on the consent agenda. We'll now move on to the Public Works Committee. Alder Jones, do you have any items for separate consideration? I think we're having a Alder Jones, we're having a hard time with your connection. Alder Jones, can you hear us? Alder Jones, I'm going to ask if I may, because we can't seem to hear you. We have a very poor connection. I don't know if you can hear me at all. If you have Wi-Fi in your house and can connect your device to Wi-Fi, it may work better. Can you hear us now? Okay. At this moment, we can hear you as well. If you wouldn't mind, Alder Jones, if you could please proceed with your report.
Thank you, Your Honor. Item 0183-20, sponsored by the chair on behalf of Eric Ross, Sign Effects, requesting permission 3 signs over city right-of-way at Gold Medal Lofts located at 1701 Packard Avenue. Recommendation that Sign Effect with this be executed and in accordance with state statute 66.0425, privileges in street. -20, communication sponsored by the chair on behalf of Public Works, submitting change order number 1 on contract 2019-0047, Cesar Chavez. Recommendation that change order number 1 for Cesar Chavez front entry, Ross Construction and Engineering be approved in the amount of $12,200. Funding to defray the from or building improvement as herein delineated. on behalf of Public Works submitting final payment for 7 Siva Chavez entry, Ross Construction Engineering, be accepted and final payment authorized for total contractor $1,587. Final payment include retainage. For 7 was authorized on the resolution 0729-19 dated July 16, 2019. 201-004, 2019 Lakeview Park Green Alley, Lalonde Contractors, Inc. Approved to be accepted and finally authorized for total contract of $179,775.78. Final payment to include retained. Contract 2019004 was authorized on the resolution dated July 29, 19, resolution 07-29-19 dated July 16, 2019. Contract 201-70032, electrical design for Main Street Movable Bridge, AECom Technical Service. Recommended AECom Technical Service on the contract 201-70032, electrical design for Main Street Movable for a total contract amount of $288,000.61. Contract 7 SWU support AECom Technical Service Consultant. Recommendation AECom Technical Services on the contract 201907 2019 SMU support be accepted and final payment authorization for and 3 cents. Contract 0 8 service. Recommendations 8 201-80032 services be accepted and final payment authorized. The total contract amount of $7.90. Contract 202-00022 DPW Central Heating Plant Chimney Demolition Azarian Wrecking LLC contract. LLC contract 20022 and being authorized for total contract $1,777. Retainage. Item by the chair on behalf of Public Works submitting bid results for contract 202-0005-20 city resurfacing south side. Recommendation that the bid for contract resurface not Physical note funds are available as herein delineated. Item 0235-20, communication sponsored by the chair on behalf of Public Works. In sanitary sewer and stormwater CCTV inspection be awarded to Green Bay Pipe and TV of $175,021.90, being the awarded to customers at bid price, at its bid price of $47,000, being the lowest defray the cost of the Public Works Department project be appropriated from DPW billing. Item 237-20, communications setting bid results for contract 202-00027-2020 sanitary sewer and storm sewer and lateral CIPP lining. Recommendation that bids Inc. at its bid price of $622,500. Excuse me. Recommends that the fund project be appropriated as listed below. $617,400, $1,110.60 from the stormwater sewer for a total price of $622,575.29 total. Physical note funds are available as item 0. Okay. Free service agreement with Johnson Control and Armstrong Technologies for an improved air handling Assistant Commissioner of Public Works operation be authorized and directed to enter into a 2-year free service agreement with Johnson Controls Inc. and Armstrong Technologies for an improved air handling monitoring. There is no cost to the city. Item 0256, communication sponsored by the chair on behalf of the Department of Public Works, submitting an addendum resolution 0203-2021 waterproofing. Recommendation resolved that the bid for reconstruction and tunnel waterproofing is awarded to A. Sun Inc. at its base price of $429,332 plus alternate bid number 1 reinforcement liquor applied waterproofing at its bid $222,000 for a total contract amount $651,332, it being the lowest responsive bidder. This work is available in account number 45040-57200 building improvement. Item 0262-20, communication sponsored by the chair Commissioner of Public Works submitting agreement with Gilbane Building Company and Miller Transport for permission to deliver oversized, overweight loads on local city streets to SC Johnson campus located at 1425 Howell Street. Permission to enter into an agreement with Gilbane Building Company and Miller Transport for the attached stipulation. Physical Item 001-90004-2019 Lakeview Park Green Alley, Lalonde Contractors, Inc. Contractor. Recommendation that change order number 1 on contract 201-90004-2019 Lakeview Park Green Alley, Lalonde Contractor be approved in the funds to defray the cost of the change or be appropriate from Art Object 45. Are available as herein delineated. Item 0270-20, communication sponsored by the chair requesting that the Public Service Committee determine the day of the week and the hour at which it will meet, but the Public Works and Service Committee will meet at 6:30 p.m.
Without objection, these items will be added to the consent agenda. Moving on now, Alder Tate, the report of the mayor. Our report, do you have any items for separate?
Is Alder Jones still talking?
I don't believe so. I think there might have been an echo.
Wow, okay. Yeah, we'll pull out item 0283-20, communication sponsored by Mayor Mason requesting to extend the declaration of emergency for COVID-19 until July 31st, 2020. Move to approve.
The motion to approve the item, is there
Second.
Second from Alder Young. Alder Tate, would you like to speak to your motion?
Sure. I mean, we had the discussion, or at least a lot of questions asked about this earlier. But as I mentioned before, hopefully alders have had a good amount of time to think about whether we're actually in an emergency or not, and that this declaration effectively declares that officially and allows us to gain resources to address it, as well as to reorient city staff and services in response. So, you know, that's what I have to say about that. And I'll allow alders to go on record as far as their position of whether we have an emergency or not.
Excellent. Alder Perez.
Thank you, Your Honor. I have a question. Some of the comments that were made earlier, if I'm not mistaken, from messages we got from the communications director, was that this had to do with funding. Is that accurate, or is that for something else?
That is correct. The emergency declaration, as we've discussed prior tonight, has are some federal and possibly state funds that might come through federal resources that require an emergency declaration for consideration.
Well, we've listed on here several whereases, and none of them seem to say that it has to do with finances. I think this resolution looks like it's deficient in that way. Apart from that, I've had many people in our community saying that because of its lack of timeliness, 24 hours and some minutes before our meeting, that this seems to be overreach and a power grab by the mayor. Could you address that, please?
I think we've discussed broadly what the role of an emergency declaration like this is. I think we've discussed broadly what it is not. Alder Perez, all I can do is restate. I think there's been some confusion between what a declaration from my office allows and delineating that from the powers that the public health administrator has around mass gatherings, which is on the agenda tonight, not to be voted on, but to inform the council of, or any other modifications that might be made around safer at home, which will be made by the health administrator. I think there's been some confusion that this resolution somehow empowers her or somehow empowers me in that way. All I can do is reiterate what the city attorney has told us already tonight. The health administrator's authority is derived entirely from state statutes. It doesn't come from my office or the resolution that is before you now.
Yes, but you said earlier that the resolution came from your office and that it had nothing to do with the health administrator's other restrictions on mass gatherings. Is that incorrect?
I think we have said several times tonight, those are two completely separate orders. So one does not empower the other. I think you asked if one was antecedent to the other. The answer is no.
Correct, but in the resolution here, I'm reading, third paragraph from the bottom. It says a now existing declaration of a state of emergency is extended and shall expire at 11:59, July 31, 2020, unless extended or otherwise modified by the Common Council of the City of Racine. And so this resolution coming from your office seems to piggyback on the restrictions of mass gatherings. You have said it's for maybe financial purposes, and that's also the email we got from the communications director, if I'm not mistaken. There is nothing in this resolution that states any of that, other than it seems like something that's being done from your office as, again, because it only came in 24 hours ago and a couple of minutes before it was, any notice we get has to have a 24-hour posting. So this limited the amount of discussion we could have with our constituents and contributed to the craziness of all the questions and comments that were being made or lack of understanding. And a lot of the comments I'm getting is that this is an exercise and an overreach of power on the behalf of the office of the mayor. And you didn't address that in answering my question, and I'd like you to please do that.
So I will state again, there is no correlation between what this order says and the public health administrator's duties. I think Alder Tate put it very well. If you think that we are in a state of emergency as it relates to public health and need to organize city resources and buildings and access to federal fundings accordingly, you should vote yes. If you do not, you should vote no.
Well, Your Honor, I don't think your answer is adequate nor sufficient, but I'll let other elders ask questions at this point. Thank you.
Alder Lemke.
Thank you very much. So I think, so I will say that I have appreciated what people have done to clarify what these orders are over time, what the recommendations have been, through the city. And I think so. I understand that there's a lot of confusion right now. I understand that people want, better communication. And I think that as a city, we need to continue to strive to that. For that, also, I recognize that as a city, we're getting communication from the federal government, the state government, the county government. We're getting communication from the CDC, health departments, all of these organizations that have to be distilled into a nice and tidy package for, people to consume at home. And so I understand that things are very confusing. And I think if we can communicate better, we should. But I also think that the people who are working to communicate what is going on are also we have to recognize that they're receiving updates day by day. And when orders lift at the state or the federal government, or when more resources or less resources are available from them, we're all impacted. And if the state or the federal government makes a decision, all of a sudden we may have to completely remake what we have done based on that. So while I understand that we can communicate better, I also believe that the people who are working to communicate this are receiving changing guidance, daily, if not hourly. And that's the reality. That's the reality of how a virus works. And so while I think, I just want to acknowledge that, yes, we should continue. And if people have constructive ideas about like, hey, this is something I'd like to see on the website, it's not really there. We should hear those things and we should fix them. But just saying that like everything is, terrible is not helpful or constructive, especially given, what is going on. I will also say, I understand very much, I've gotten communications from businesses. If my livelihood depended upon, whether or not the Safer at Home order is lifted or not, I would be very concerned about what orders were coming from the city, the state, the federal government, and what fundings were coming. I think that is, beyond reasonable. That is people's livelihood. And so I think what people should hear, and what I think has been made clear is, and I think Art Howell probably did the best job of the night describing in an ABC kind of way what the things were going on at the state and what the things were that were going on in city government and what those things meant. And so for the people who are worried about Safer at Home or how that is impacting their business, what I think that they can hear and what I hope that they've heard over the course of the night is that ends May 26th. We have two things on the agenda. And in column 1, there is the mayor's declaration of the emergency. That is not Safer at Home. What that is giving them the ability to act nimbly. What that is allowing them to apply for funding, and it does apply for funding. If we've sitting here all day and said, thank you, Administrator Bowersox, thank you, Mr. Howell, Chief Howell, thank you to the fire chief as well. Those are the kinds of people who will get funds from FEMA. Those are the kinds of departments who will get funds when we have an emergency order to apply. And so I don't think that we can say that we don't want an emergency order to say, yes, you can apply for federal funds, and then vote against that and look Art Howell or Dottie Bowersox or the chief in the eye and say, well, we just didn't think that you deserved the funds to do what you're doing, when they're breaking their back to try to help people to keep us safe from not only COVID, but from everything else that they would normally be doing. I think, to say that we don't think that they should be able to apply for funds and then thank them is disingenuous. I think, if you are concerned that this is Safer at Home, that is a rightful concern. I think it's been explained that it is not. Category 1 is just, do we think people should be applying for funds? Do we think people should be able to respond? The health department should be able to respond quickly. The second thing is separate, not related. It's about whether there should be large gatherings or not, related to the city property, related to public spaces, related to the things we permit for. So things like festivals. Those things are decided by Dottie K. Bowersox, not us. And whether or not we like that, her power is given to her not from the city council. Her power is given to her from the state government. So if we don't like them, that is something that has to be taken up with the state, because the public health ability to limit mass gatherings is by statute, not something that we can vote on. Those things are powers of the health department, and those things are delivered by the state. And so if we don't like that Dottie K has those powers, the entirety of state law needs to be changed, not what we are doing here. She is not given those powers by council. She does that independent of us. And so there are 3 categories: Safer at Home, which is expiring March 26th, and which I think hopefully people understand now. The mayor's executive order, if we approve it, which is going to allow us to be more nimble and apply for funds for the people who are keeping us safe, for the people and you can shake your head all day long, but I will not look at the police department, the fire department, and the public health department and say, yes, let's not give you the funds that you need to do your job. And then the third thing is Dottie K's powers to limit mass gatherings, which she has regardless of what we do as a city, because it is a state statute. And if you don't like that, you need to talk to your state official. That's it.
Alder Lemke. Alder Peterson.
Yes, thank you. Everything's been made relatively clear to my satisfaction that they are two totally different issues, the executive order and the stay at home. My only concern is for the little bit of confusion that's being created in that I asked Dottie for clarification as to whether or not businesses will be open after the stay at home, and there was no answer. So that will create confusion for the public going forward. I agree that with the emergency declaration, and I will be voting for the emergency declaration. I would say it creates further angst and confusion when you don't get an answer that businesses are going to be open in some form or fashion from the city health administrator. Thank you.
Thank you, Alder Peterson. Alder Glenn.
Thank you. My biggest thing about this emergency order is why so long? Why longer than the other ones? When we just started testing and everything, and next week we'll really have a better grip on, this virus throughout the community. Why is this emergency order so long when we are trying to really figure out the pandemic and how it is affecting the citizens of Racine, or if it is even affecting, the citizens of Racine?
Alder Glenn, the one thing that both orders do have in common is that they run to the same date. So both this order and the mass gathering order run through July 31st and run concurrently, just to acknowledge the scope of time that the city may need to address those issues.
Okay, but when we're only thinking about testing as of 2 weeks ago, I really don't think this order needs to go out till, I think I would be more comfortable with it going to the end of June versus July 31st. A lot of reasons for that, and especially for the one, what Dottie K has put in place. I'm going to continue to be cautious when I go out there. I have 2 munchkins that I really need to keep safe. And then I'm sure there's a whole bunch of other people out there that are exactly like me. They're still going to do some sort of stay at home. They're still going to do what nobody wants this virus. Nobody wants this virus. So, I mean, this date going out to July 31st, I think is just too long right now. We can still come back and have, claim a state of emergency after June 30th. I think it's just too long out there with the things that we have in place now. So, I mean, who came to the decision of July 31st?
Again, Alder Glenn, the thinking was to run them concurrently with the length of the mass gatherings timeframe that Dottie K. Bowersox laid out. But ultimately, the wording and the content of the declaration from the mayor's office came from me.
Okay, that still didn't answer my question, which I don't think you get an answer for tonight, but I'll move on from that. But I do have a few questions about, are you working on any federal or state grants right now under the emergency declaration?
So yes, there's a number of federal funds that become available. I think to Alder Lemke's point, there's a number of federal funds that have become available. There's the CARES Act that is a federal pass-through, and just in the last few weeks, we've seen Congress do 3 separate pieces of legislation around coronavirus. And just today, there was an announcement made of how the state government was going to disperse more than $1 billion related to coronavirus. So those are all avenues that we're pursuing. Obviously, we're looking at both public and private support wherever we can to help us best mitigate coronavirus here in the city.
Okay, no, I surely do understand that. I surely do understand it. This is, the length of it is just, I just don't think the city and the citizens of the city of Racine wanted to see that go that long. Like I said, I am going to still be cautious with everything that has been going on. I'm just not going to run out there and do things. I mean, no different than going to Walmart is what I'm trying to say. I do appreciate everyone out there that's working on it. I just really wish that this didn't have to go over 2 months for this declaration of emergency. That's it. Thank you.
Thank you. Moving on to Alder Taft.
Thank you. I appreciate the questions and the concerns of all of colleagues here on council and the clarifications and lengthy conversation we've had about these issues. So I don't want to spend too much time discussing them, but I do want to make a couple of points. So we are in the middle of a pandemic. Our number of cases and the rate of cases is skyrocketing. We as a city have a responsibility to protect people and do everything that we can do to make sure that those cases start to decrease. And so this is our response. You know, we're doing the best that we can. Now, I think that the emergency declaration has been discussed in terms of funding and providing funding, but I think it's important to remember that it also provides flexibility for the internal workings of the city, for us to be able to decide to continue having meetings virtually or not, or allow people to work from home or not, or it gives the individual departments and people who work for the city flexibility and additional protections, and I think that's really important. So I don't really have a problem with the length of the order regarding giving the city the opportunity to have flexibility and apply for more funding. That does not bother me whatsoever. In terms of the second order, as we have mentioned many times now, the public health order regarding mass gatherings is a separate thing that is not in the jurisdiction of council. I think people need to understand that Racine is relatively unique in that the fact that we have our own public health department and our own public health administrator that has this authority given by the state to make these orders to help protect people. And so I think that's something that people don't, it's something I didn't really understand until relatively recently and being on council. So that's important. And I think it's also important to realize, to reiterate what Alder Lemke said, things are changing on the state level and the federal level all the time. We are going to get clarification for guidance for businesses this week, 2 more days. And it's because the public health department is using all the data that is available to them to make sure that they can provide some guidance over this time period and not have to change it if they don't have to, and provide, you know, clear rules and clear guidance for folks so that we don't have this confusion. So I think because the council isn't voting on this order anyway, this is a public health order, the item that's informational coming from the public health office. I think it's not unreasonable, given the events of the state last week and the changing guidance from the federal level and the state level to do this right. So I don't begrudge the public health administrator an extra 2 days to come up with these guidelines for the businesses so we can get it right. And so those are my comments. I'm going to be supporting the emergency declaration that gives the city the flexibility to determine how people work as well as get funding. And I appreciate that we have a public health administrator looking out for the health and well-being of our citizens, including all of our business owners that upon whom our city depends. And we appreciate them and we want them to be successful and open safely. So that concludes my comments.
Thank you, Alder Taft. Alder Jones.
Thank you, Mayor Mason. I just had one question. If we vote, and I think it may have been answered, but I think this would help clarify some of the calls that I hidden in. Do something different once this resolution is passed. Declaration, does it give you any powers to enforce or create a rule to extend the stay-at-home? prior May 26th. That is some of the comments that I received. That some people are thinking there's something in there that will give you permission to extend that stay longer than the 26th. Thank you.
Alder Jones, can I repeat your question and see if I heard you correctly, because it was breaking up a little bit?
Sure.
The question was there something inside of his declaration that allowed anyone at the city to extend the safer at home? Is that correct?
Yes.
Okay. No, and it's a good question, Alder Jones. Just to reiterate, that is, there's nothing stated in the declaration that says anything specific at all about safer at home. And again, this is a decision that will be reached by our public health administrator, Dottie K. Bowersox, separate entirely from the item that is in front of you now. Thank you, Alder Jones, for your question and that clarification. Alder Santiago.
Yes, thank you, Mayor. Not to beat a dead horse, but I would like to just say clearly, because I have been in communication with, you know, some of our largest small businesses in the city today, and you know, they are really our backbone. And I feel like there's a lot of mistrust and confusion going on. So I do want to state clearly right now that, you know, even if this declaration were not to pass, Dottie K could still issue the stay-at-home order. So they have, again, they have nothing to do with one another. It could still happen even if we were to vote it down. So you know, a lot of people are saying out there, hey, if we vote this in, then they're going to close things down. Well, it could happen if we were to vote this down right now. But I would like to, yes. I would like to say though, that it is unfortunate that Dottie K did not have some clear expectations or guidance on where we are going with, you know, the small businesses at this time. I just feel like it's poor timing, and you know, is probably more so fueling the distrust, especially from the small business owners in town. I'm a small business owner myself, and you know, a lot of people are very worried. And you know, I think that in the future we need to do a better job of stating more clearly what's to expect. And you know, I know that Dottie K and the team are working very hard. I just feel like this is poor timing, and with the state of everything and how worried our small businesses are, you know, in a city where our economy is shaky as is, you know, to have distrust from some of our backbone businesses, you know, it doesn't look too good to me. But you know, I do understand that there is a pandemic going on, and you know, we do need the funds. You know, we need to make the right decision here. A lot of people feel like this is a double-edged sword, but just so people do know, you know, once again, you know, you see it in the comments on Facebook. You know, just if we vote this through today, this does not have anything to do with closing down the city. So I just wanted to speak that piece just so that we can say it clearly. You know, let's just get it out there, because a lot of people are still saying it. They don't believe us, you know, whatever. But yeah, state it clearly for everyone. I hope everyone understands that. And hopefully we can be more transparent in the future. Thank you.
Thank you, Alder Santiago. Alder Land.
I'd like to clarify that -20, because it's going back and forth on two different items, and we should really only one.
That is correct, Alder Land. I think there's been discussion about the confusion around these items and the safer at home order. It would certainly make it clear to people if we dealt with them one at a time. I understand the need to clarify it, though, given the miscommunication that's been out there, particularly on Facebook, particularly from some of the alders themselves. But I do know that that it has caused a great deal of confusion. But your point, Alder Land, about what is it that we are debating right now, the item before us is item 0283-20 at the top of page 12 on your agenda on the extension of the declaration of emergency. Alder Land, did you have any other questions or comments about this item?
Well, I think that we need this to do the various things we talked about, and I do think it's separate from Safer at Home, which has been announced that that is set to expire May 26th.
Correct.
This is a totally
8 a.m.
different thing.
Thank you. Alder Perez.
Thank you, Your Honor. So that was one of the comments I was going to make. A lot of the discussion has not been based solely on the resolution. I have a couple questions related to that. Kenosha, for example, cleared, they're a similar size city. They're right next door. They got rid of this. And there was some legal difference between a county and a city. The city attorney could address that for us and explain what the difference is. Now, before we do that, though, I understand that we have really no authority to block the health administrator's order. I get that. My problem is with this resolution, because even though we kept saying it doesn't affect Safer at Home, okay, true. But again, the third paragraph from the bottom says a now existing declaration of a state emergency is extended and shall expire at 11:59 p.m. July 31, which goes on to a further date. Has nothing to do anywhere in the whole resolution with that, hey, this is about funding. And it's not, it says the resolution from the council, and a resolution has the effect of law. So whether we discuss it here or not, if it's not written on paper, when it gets interpreted in the law, it has no effect because it's not what's on paper. And so I'm thinking that this resolution in itself is deficient in that if the purpose is to obtain financing, then we need to put that the purpose is to obtain financing. And even though it repeats some of the same points as the other restrictions on mass gatherings, we need to see that in effect, it doesn't do that because it goes whereas, and then now existing declaration. What is the intent really of this resolution if whether we vote for it or not, as was said previously, Dottie K's BARSOC's order has effect of law. And so this isn't about whether we're going to honor the police and fire department, and this isn't really about what President Tate said about, you know, if you think it's this, vote this way. No, it's not that. Look at the paper that we're voting on. It doesn't say anything about funding. It does do this, and in effect tells our community, you can't go out, and the council, by way of the mayor, by this resolution, is saying, you can't do anything until July 31. Yes, we're going to put orders out next week. We'll gradually let you go. But how is this document sufficient? So 2 questions I have for the city attorney. One is, could you please explain the difference and why some of the opinions, especially from the attorney general, are saying that this may not be effective and yet we're going with it? And the second one is, do you see this as defective because it doesn't mention anything about funding? And if we keep discussing that it's about funding, when this gets interpreted in front of court of law and it has no funding aspect to it, how are they going to think it's about funding? Can you address that, please?
Sure. Let me take your second question first. And there has been some discussion about this resolution, this declaration, that is beyond just funding. So let me say that this particular declaration is an extension of the declarations that the Common Council ratified on April 20th. So the Common Council has already done exactly what's in this declaration. This would extend the time. This declaration of a state of emergency has to do with internal city governmental operations. It doesn't have to do with health orders. It doesn't have to do with operation because of the the statutes we're referencing and the ordinances we're referencing, we're talking about city operations. That includes, for example, the ability to apply for funding that's available during a state of emergency. It includes, for example, being able to handle employee groups in a different way. It includes allowing employees to work from home. It includes, as Alder Taft said, it includes the fact that there is an order that allows the Common Council to meet virtually. Were there not a declared state of emergency in the City of Racine government, Common Council members and all committees and all commissions, boards, and authorities would all have to come to City Hall and meet in person. This includes the ability to restrict access to city-owned buildings. Those are all the kinds of things that can be undertaken under this sort of an emergency declaration. The statute specifically says that the city may undertake any actions which are necessary and expedient to deal with the state of emergency. So that's what this particular declaration does. It doesn't need to list everything specifically because it references the statute and its statutory powers that the city is enforcing. This is the Common Council's declaration. It's not the mayor's declaration. Originally, the mayor declared, Common Council then ratified, but at this point, it is completely in the hands of the Common Council. The mayor is presenting it to you. As to your first question, so the city of Kenosha does not have its own public health department. The city of Kenosha operates under Kenosha County's health department. And I understand that there was a legal opinion from an attorney working for the Counties Association that said Emergency Order 28 is not enforceable. I agree with that statement. Emergency Order 28 is not enforceable. That is not what the City of Racine's local health officer did. The City of Racine's local health officer adopts the provisions, the particular specific provisions of the emergency order and adopted those. The statute involved 252.03 specifically allows local health officers to undertake any actions that are reasonable and necessary, and that is the words of the statute, reasonable and necessary to deal with this particular infectious disease. And by the way, that's exactly what the Attorney General said. The Attorney General's opinion said that local health officers do have this authority. Made very clear that the Supreme Court did not say that these kinds of orders are illegal. The Supreme Court specifically said that the Department of Health Services Secretary Designee did not follow the correct procedure in implementing the order. Did not say that these kinds of orders are illegal. So again, these are separate, and the local health officer is allowed to do what she's doing. I know that's the next item. But again, this emergency declaration is about internal city governmental operations. It has nothing to do necessarily with health orders, okay? It sets a stage for how the government operates under these circumstances.
Alder.
Yeah, I've been fielding a lot of calls on this for the last 2 days. You know, some of the people telling me vote no until we get okays that our businesses are going to be open. And I'm struggling here. We have to go through with this order, I believe. My personal thing is I'm not putting my businesses in my district at risk. I believe this is something we have to do. People have to know that I don't believe the city is trying to keep businesses closed down here. This order has nothing to do with these businesses being opened or closed past the date that we specified here. So I think we need to vote on this thing and move forward with it. And just want to let everyone to know in the business community that we're supportive of them. This does not go against anybody. Thank you.
Thank you. Alder Tate.
Thank you, Mr. Mayor. It has been a interesting night and a lot of repetition, but I think that's okay when people are confused and don't fully understand, everything that's going on. You have to kind of say things a lot. I think one thing that's necessary as alders, as elected officials, it is important that our job is to share information accurately with our constituents. And when we share that information, our secondary job is to explain what that information means. Most folks don't read statutes and write them day by day. That's not their regular job. That is our job. It's not our full-time jobs, but it's our job as elected officials to be able to read legislation, write legislation, and translate legislation for the people we represent. So it's incumbent upon us when we get resolutions, declarations, orders, that we should be able to distinguish what those each mean for our constituents, as to not create situations like tonight or today or the last couple days where people's hair's on fire because something went out there without it being explained what it actually means, or something went out there that was entirely inaccurate. And that's not okay. That's exactly what we were warned by of happening from the governor when the Supreme Court struck down the Secretary Poham's order. Confusion, because now we have all these little silos of individuals and silos of communities trying to piece together how to manage a pandemic, as opposed to having one statewide entity address that, and then the rest of us rally behind that and work together to keep our communities safe. So that's one thing, just for the edification of fellow alders. Know what you're talking about before you talk to people, and then explain it to them so that they don't have to be terrified in the middle of a crisis by some misinformation that goes out. Second, it's important as far as this particular declaration. Again, it's a declaration, not an order. We're declaring a state of emergency for the city of Racine in response to this public health crisis. We've been in a state of emergency since, I believe, early March, and we're continuing to be, because as we see the data, the situation has not changed. It's actually escalating. And for those who believe it's escalating simply because of testing, that's not the case. The percentages of positive cases are also increasing. So when you see testing go up and positive cases raw, that'd be one thing. But if the percentage goes up, that's a different thing. That indicates more spread. That indicates greater contagion. And it's important, again, as alders, that we have the ability and capability to explain these facts so that people aren't scared, aren't freaking out, aren't angry at something that they don't fully understand because we haven't helped them fully understand it. That's our jobs as elected officials, is to share the information accurately and fully. I heard a few questions that still kind of indicate some misunderstanding of what this is. As far as the timeline, which was a very good question, asking why to go to July 21st. It's a fantastic, July 31st, excuse me. That's a fantastic question. That's a reasonable question to ask the timeline. It wouldn't make sense for the city of Racine to set a different timeline than what its public health director does as far as when a situation expires. That would be really strange for the city to say, yeah, our declaration of emergency is over in June 1st, while the public health administrator is setting a timeline for something else. So that's one piece. But the other side of it is, in the actual resolution, for those of us who read it, it literally says, quote, "The now existing declaration of state of emergency is extended and shall expire at 11:59 p.m. on July 31st, 2020, unless extended or otherwise modified by the Common Council of the City of Racine." That means if we're getting data and we're getting recommendations from the public health administrator about how the spread is being contained, how the numbers are decreasing, how we can continue to expand and dial back particular restrictions that are in the City of Racine's operations, which is what this declaration deals with, then we can dial back the declaration of emergency. And we don't have to keep it in place until July 31st. But anything we do as a common council, anything we do as a government in the City of Racine should be based on the data that we see and the expertise of the people who work in the fields that we need the expertise from. We take that advice, we mesh it with the concerns of our constituents because we're representatives, and then we have to make informed decisions. But that's our job as elected officials. That's our job as alders, to be informed and not to misinform other people. So, again, the crux of this is either we're in an emergency or we're not. There's no need for this particular item to have funding in there. The fact that we're making the declaration provides the opportunity for us to receive funding. That's where that is. We couldn't get the funding if not for the declaration, because that's the standard that exists for federal and state agencies such as FEMA. So, these are some decent questions at times, but other ones just, it seems almost willful that we don't want to understand. And that's a reality. You can repeat things until the cows come home. Some people don't want to understand certain things because they want things to happen a certain way. It doesn't matter how much you explain it. It doesn't matter how much you tell them. It doesn't matter until they actually experience it, which is what we're seeing with this pandemic, is people will think that it's a hoax. People will think it's not real. People will think that it's made up and it's not really affecting us until they get it, until it's a family member of their own, then it's real for them. And it shouldn't take that for our society and for our city to do the right things for it to affect us directly.
Thank you.
I have a family member who asked me not to identify them who has tested positive. So if I'm a bit serious about this, maybe that's partially why, but I was serious well before it came to my house. So for the rest of you, perhaps you could put yourself in somebody else's shoes that's been exposed to this, particularly for the Black and brown people in the city of Racine who are suffering the most from this. It'd be great if we could come together for the communities that are often left behind in the city of Racine and stop trying to divide us between workers and safety and businesses. We're all in this really together. And whether you like it or not, this is a double-edged sword. The pandemic does not choose who it goes to. We don't get chosen to have our job shut down. We don't get chosen to get sick. We don't get chosen to go to the hospital. But the reality is safety and businesses, sometimes they don't mesh, but we're doing the best we can as a city to make sure that both can sustain themselves. We've sent out over $800,000 since this started to try and sustain businesses. So please don't suggest that the city of Racine is anti-business or wants our businesses to fail because of this pandemic. We just rather not see businesses fail because people die en masse. So do what you're going to do, council members, as far as this emergency declaration. If you think it's not real, if you think it's not an emergency, by all means, vote no. But if you think it's real, if you've experienced it, if you don't need to experience it to recognize the seriousness of it, then by all means, please vote yes so we can continue to do what's necessary to protect the safety of our citizenry. Thank you.
Thank you, Alder Tate. Alder Glenn.
Thank you. Just to let you know, I have experienced it, so I come here with a heavy heart knowing exactly what this pandemic is. My biggest thing here, and I'm going to repeat this, why don't we, this declaration really needs to end at June 30th. If it goes out to July 31st, we're going to end up dialing back on these things. We don't need to do that. We can always extend it. It is, and I definitely feel that this is a total power grab here, and I think we also should wait. We can have an emergency meeting regarding this to see after what the testing results are for this. And you say that your declaration is not in with what the health administrator said. Let hers go out to, she can make these decisions whether we're in a pandemic or we're not in a pandemic. So we don't need to go along with what she says as a declaration of emergency. So I think more alderpersons would feel a lot better by this ending. I truly think that by this ending, this declaration goes out till June 30th. We have time to decide, if it should go any further. I mean, we're sitting here with what Dottie K is asking, even though, we're just voting on to receive and file, but she has not really put out there what small businesses can expect right now. This is their livelihood. she's not putting anything out there. And Corey, as well as you, as I know, you have been going up and down on Facebook and seeing these comments that people are making that are watching us tonight, that most of them are small businesses and they are very confused. And I don't think we need, to keep putting them in that position. So if I could make a motion, I'd like to make a motion for this declaration of emergency to end June 30th, 2020.
Alder Glenn's making an amendment to the motion to change the extension of the declaration of emergency from July 31st, 2020 to June 30th, 2020. Is there somebody who would like to second that motion? If you would like to, if you can raise your hand icon. The amendment fails for lack of...
Oh, Henry raised his hand. Sorry, Alderman Perez did raise his hand.
Oh, there it is. Alder Perez, are you seconding the motion?
Yes, sir. Thank you.
Okay. All right. Alder Glenn, would you like to speak to your amendment further?
Yes, please. I mean, I truly do, like I had said earlier, I do understand this is a pandemic. We can always extend this emergency. But I think for really with all the people that have called me, emailed me and everything else, it just seems like this is just way too long to put it out there over 2 months. I mean, that they're not seeing the light at the end of the tunnel. Maybe only having it, I'm sure only having it till June 30th, they're going to see the light, and then they'll understand if we need to extend this. Right now, I don't, really know, didn't really get a straight answer as to what federal funds or state funds FEMA has out there that we can apply for. But I'm just saying, just give the city a little bit of hope and just only send this out right now till June 30th. Obviously they still have lots of questions. Let's, we can always extend it again. Thank you.
Alder Tate.
I believe Alder Perez had his, oh, no, it went down. Yeah, Alder Perez had his hand up before I pressed it.
Sorry. Okay, is your hand up or down? I'm sorry, it's gone.
Yeah, it's up there.
Okay, go ahead.
I agree with Alderwoman Glenn. I think the city is in a situation right now where most of the community is very distraught. And following up on a comment that was made earlier, in the last 2 weeks, I've had 5 friends throughout the United States who have passed away from COVID. So I know that the emergency and the veracity of this is true and real. And I guess we have to balance how we give hope to our community with not only hey, people are dying, we have to be careful, but there's hope for your business and your community as well. I don't think that the way this is written right now does that. If anything, we should really tone it back, like Alderwoman Glenn said, to just, another month and then go from there. If we need to do it again, we can do it again. That's not a problem, because we have this ability. Also, this says it's a file type resolution, which has the effect of law. Now, it's not just a declaration, as some of the members have said. If you took the training lately, you'll see that a law and a resolution is different, but they're very close. It's not just a declaration. When I look at our community and I look at their distraughtness, the veracity of the COVID-19 attack on our community, as was said earlier, our friends in our community who apparently are worse hit by this. I am concerned. And as I look at it, I also see that we have to be responsible. We've put out hey, stand 6 feet apart, 13 feet apart. If you're 13 feet apart, if you're singing, wear a mask, wear gloves if you need to. And then I look at what's really happening in our community and go, wow, none of this, or not a lot of this, is happening in our community. And yes, I'm concerned. But again, I look at the disaster that's going on in our community with our businesses that are unable to open at this time, especially our downtown. We're building 3 hotels. Where are they going to come to if all those businesses will not be able to open because they have no financing yet? today, like I might have said earlier, I don't remember, but I was definitely thinking it. Two of my friends declared on Facebook that they're closing their shops permanently, two city shops. So, we look at the issues here, we look at our tax base, we look at saving people's lives. And the testing only helps us recognize that the threat is real and gets people into healthcare if they need it. But if you present yourself at the hospital and say, I'm sick, they have to take you. They're not going to just throw you away because you don't have COVID-19. And I think we need to balance the medical emergency in our community with our community's success as well. I know it's hard, but as I look at all the businesses downtown that are barely making it because they can only have 10 people in at once, even if they have that many or don't. The point is some are even closing because of their financial distress. We need to balance how we take care of our people medically, professionally, financially, and all those issues. So I think that, the way this is written doesn't really satisfy me that it meets its purpose. But if we tone it down a month, I'm more inclined to vote for it because I see that it gives us a little bit of hope as opposed to going out 2 months for people in our community. Even as the president said, you don't know what you're reading. Well, it's because it's not really that clear. People don't know how to look up statutes. I tried looking those up earlier today, and I've even looked up statutes and made mistakes because I don't get exactly how it affects what we're writing. And, I've challenged that before. I'm used to reading statutes. So I know that the regular person may not understand it. And it's obvious from tonight that a lot of us may not understand it either. As we move forward, I think we always have the opportunity to come back. This declaration, if it really is for funding, will still get us in the loop for the funding. And moving it back a month is not going to hurt anything, especially if we can come back in the month and add a month to it if we see that the necessity is there. I understand that by the end of the week, the administrator of the health department will be giving us more guidance as to who and how can open. And that's wonderful. I'm looking forward to that. I'm looking forward to our community being able to be involved in more business transactions. And, but I look at my friends like, small businesses downtown, and I'm really concerned that they're not going to be able to move forward with this. We need to open it up a little bit more. And so the balance has to be there. I mean, we're being called upon by our community to be responsible, and this stinks a little bit to me. And I get it. It makes sense to some of y'all. I understand that, but I think it's a little bit of an overreach. And I think the way it was done was sloppy. I know we can't always do everything right, and we have to look at numbers and we have to act quickly. I get that part. And I apologize if I offend some of you, but that's what I believe, but that's also what some of my constituents are saying. And so as we look at this, we need to consider dialing it back a month is not going to hurt us. Let's dial it back a month and see what comes up in the next couple of weeks. Bring it back next month if we need to add another month. And then we can go from there based on the statistics we have. Thank you.
We're talking about this declaration as though it's something that it's not. Again, it's still not in order. It's about internal facing activities for the city of Racine and securing of funding. And it wouldn't make sense on the face to have a declaration of emergency out of alignment for the period of time that the public health administrator has declared restrictions would be in place for certain activities as it relates to the public health crisis. That just doesn't make sense. Additionally, as we talk about giving people hope, what happens to hope when it is taken away again? We get to June 30th and we're not in a position to change things, and then we have to extend it. That has the same effect, if not a worse effect, of setting out a date that is further out, but potentially not the end point, and that can come back sooner. That's different. And I think that's a distinction to be made in terms of, providing hope. Yeah, eventually we will be out of this. but it's also shouldn't be false hope. I mean, we don't know when this is going to end as far as this general health crisis. We don't know when we're going to get to a point when we're able to address certain things and make sure that, you know, the standards are out there and that people are able to comply with them and, you know, keep everybody safe and see the numbers start to go down. Like we don't know when that's going to be, but we have guidance from the CDC. We have the Badger Bounce Back Plan from the state government, all of which provided particular benchmarks and steps to reach before we could dial back and start doing certain things. Again, that's not what this declaration is about, though. It's about internal facing activities. So it seems like we're hung up on setting a particular date for something that affects internal operations. And we don't know when we're going to get to the point. So why suggest that it could be in 30 some days, as opposed to the reality is we're already nearly 60 into this and it's not slowing down. It would be naive almost to think that it's going to take less than that to finally get to a place where we're not quite where we need to be to fully to dial back our declaration of emergency, to not be in a state of emergency anymore. So I'm going to speak against the amendment, again, for the same reasons that were proposed by the proposer. As much as we could add it to, we could also take back from it. And I think the effect of adding more time is probably slightly more detrimental to the general psyche than it would be taking away time. As we see from the response the last 2 days, the addition of more time has caused this firestorm of confusion and frustration and just for the declaration of emergency, not even fully understanding what that means. So imagine what that is 30 days from now when we have to do it again because we're not quite where we need to be for us to be able to assess that we're not in a state of emergency anymore. That's why I'll be speaking against this. I think also in alignment with our public health administrator, it makes sense to have a declaration of emergency for the same period of time that she is using her emergency powers as the public health administrator. Thank you.
Thank you. Alder Taft.
Thank you. Okay, I'm going to try and keep this short. All right. So this order that we are discussing, this emergency declaration, has absolutely nothing to do with when businesses open or what they do. And it is irresponsible as alders for us to conflate the two or imply that they are somehow the same thing, because they are not. Okay, they are two separate things. What this declaration does is it gives us flexibility to continue meeting virtually, to allow city staff to have flexibility on how they work to protect themselves. And it allows us, we need it in place to apply for certain kinds of funding. That is what it does. Okay, so it is not responsible for the city to have a different timeline than the public health administrator does for her orders, because she is using all the available data and making responsible decisions. And it would be irresponsible as a city for us to have a different timeline than our own public health administrator does for this particular emergency. It does nothing for business. It does nothing. This is just allowing the city flexibility to do everything we can to protect our staff, to protect to do all the things that we need to do virtually, and to apply for funds. So I would say it is irresponsible, one more time irresponsible, to have a different timeline that has been set out by our own public administrator. So I'll be voting against this amendment. That is all.
Alder Glenn, did you want to speak to your amendment one more time?
Yes, I did. These are two separate. What the city health administrator is asking for, and for the Declaration of Independence. These are for emergency. Sorry, these are two totally different things. I'm not asking you to put them. You're asking us to put them two together. This is not irresponsible. If it's anyone being irresponsible, it's who's asking to have this put together, because the health administrator can go on for months after this is done and over with to have this. And as to dialing back, I think the other declarations that were put out there, we kind of didn't even speak on them much at all. But now we're saying, hey, citizens of Racine, this is what we are doing. We're going to I think after watching tonight's common council meeting, they're gonna have a better understanding of a lot of things and what this emergency of declaration does do. They're gonna have a better understanding. We're saying to them that we understand you, but right now we need to declare a declaration of emergency to try and find ways to get FEMA funds to help even small businesses or anything else out. We put this out there June 30th. We're going to we're going to look at this again. So they're in the full understanding that this may, the emergency declaration and everything else may end June 30th, but with the understanding that if things haven't gotten better, this pandemic has only gotten worse, fine, then we will go another month. No reason for this to go all the way out. They'll be understanding that, you know, hey, the possibilities of us extending this are great. So only giving them more to say, hey, we need to better, you know, keep the social distancing, even though we don't have to, or anything else like that. They're going to want to make this happen. The citizens of Racine are going to want to make this happen. Let's show them that we trust them because they're not trusting us right now. Let's show them that they can entrust in us and we have their best interest at heart.
Thank you, Alder Glenn. Alder Taft, your hand is still up. Did you want to speak again or?
Nope, I'm sorry.
Okay. Alder Land, your hand is up.
Yes, I just want to say that I don't think we need this amendment in here because it says right in here, the existing declaration of emergency is extended and shall expire unless extended or otherwise modified by the common council. We already have the ability to extend or modify it. So I'm going to vote against it. Thank you.
Thank you. Seeing no further hands in the queue, I will ask the clerk to call the roll.
Start with Alder Glenn.
Alder Glenn? And just to be clear, we're about to vote on the amendment to item 283-20 to change the extension of the declaration of emergency from July 31st, 2020 to June 30th, 2020. Alder Glenn, on the amendment, how do you vote?
Yes.
Alder Santiago?
Yes.
Alder Perez?
Yes.
Alder Miedema?
No.
Alder Coe?
No.
Alder Peterson?
No.
Alder Levy?
No.
Alder Tate?
No.
Alder West?
No.
Alder Land?
No.
Alder Horton?
No.
Alder Lepke?
No.
Alder Jones?
No.
Alder Taft?
No.
Alder Young?
No.
That would be 12 noes and 3 ayes.
So the motion, the amendment to that motion has failed. We've had much debate on this. We will go to a vote on 0283-20 without the amendment. Again, this is a direct referral communication from Mayor Mason requested to extend the declaration of emergency for COVID-19 until July 31st, 2020. We'll call the roll again. Alder Glenn?
No.
Alder Santiago?
Aye.
Alder Perez?
No.
Alder Miedema?
Aye.
Alder Coe?
Aye.
Alder Peterson?
Aye.
Alder Levy?
Aye.
Alder Tate?
Aye.
Alder West?
Aye.
Alder Land?
Aye.
Alder Horton,
Aye.
Alder Lemke,
Aye.
Alder Jones. I'll take that as a yes. Alder Taft,
Yes.
Alder Young.
Aye.
That would be 13 ayes and 2 noes.
Okay. Alder Tate, did you have other items for separate consideration under the mayor's report?
I've received no requests.
Would you like to move to receive and file item 0284-20?
Yeah, this is item 0284-20, communication sponsored by Mayor Mason on behalf of the Public Health Administrator submitting a public health order in relation to COVID-19 restrictions on mass gatherings. Move to receive and file.
The motion to receive and file, Alder Young, is there a second?
Second.
All right, Alder Tate, do you want to speak to your motion?
I think we've spoken at length on this, particularly the motion to receive and file is the appropriate action, as we do not have the authority to vote no or yes in this that exists within state statute.
Thank you. Alder Horton.
Oh, I need to take my hand down, Your Honor. I'll take it down.
Okay. No worries. Alder Perez.
I'd like to record an objection to the order, Your Honor.
Duly noted. All right, seeing no further discussion on the motion to receive and file, the clerk will call the roll. Please vote aye to receive and file or nay to not receive and file. Alder Glenn.
Abstain.
Alder Santiago.
Aye.
Alder Perez.
Abstain.
Alder Meekma.
Aye.
Alder Coe.
Aye.
Alder Peterson.
Aye.
Alder Levy.
Aye.
Alder Tate.
Aye.
Alder West.
Aye.
Alder Land.
Aye.
Alder Horton.
Aye.
Alder Lemke.
Aye.
Alder Jones. Oh, so, Alder Jones, please stop pressing your mute button. Alder Jones.
Aye.
I need you just to say yes or no.
Yes.
Okay, thank you. Alder Taft.
Aye.
Alder Young.
Aye.
Okay, the motion to receive and file passes with 13 ayes and 2 abstentions. Alder Tate, did you have any other items for separate consideration under the mayor's report?
No. Item 0280-20, communication sponsored by Mayor Mason on behalf of the Racine Literacy Council, Legal Action of Wisconsin, Racine Creative Center, and Racine Revitalization Partnership for amendments of their 2019 CDBG funding contracts to extend the expiration dates until September 30th, 2020. Recommendation is that the amendments be adopted. Fiscal note is that the fiscal year 2019 CDBG contracts budgets for their respective entities will remain the same thanks to this action. Item 0281-20, communication sponsored by Mayor Mason on behalf of HALO for an amendment to the 2019 ESG funding contract to extend the expiration date until no later than June 30th, 2021. This recommendation is that the amendment be approved. Fiscal note is that the total fiscal year 2019 ESG contract budget for HALO will remain the same. And last item, 0282-20, communication sponsored by Mayor Mason submitting the loan request from Alicia Garcia of 1135 Davis Street for a homeowner loan. That's it. That concludes the mayor's report.
Seeing no objection, the remainder of these items will be placed on the consent agenda. Alder Tate, at this time I would entertain a motion to approve the consent agenda.
Move to approve the consent agenda.
Alder Young, is there a second?
Second.
Okay, I'm going to unmute everybody here quickly, so please try to avoid any background noise. All those in favor of the consent agenda, please say aye.
Aye.
Any opposed?
Sorry, Nate.
One nay. The consent agenda has passed. That concludes the agenda. For the most part, we will now move on to announcements. Just as a reminder to everybody, announcements are not to discuss or debate further anything that was on the agenda, but rather items that are about recognition of city residents of employees, memorials, non-political community events, discussion of matters related to this agenda or government business is prohibited. Is there anyone who would like to make an announcement? Alder Perez.
Thank you, Your Honor. I'd like to just remind everybody that our zoo is a wonderful thing in our city and it needs our financial support. And if you're willing and able, they'd be more than willing to have some of your finances. And if you have extra bananas, probably that too. Thank you.
Thank you, Alder Perez. Any other announcements from members of the council? Seeing none at this, oh, sorry. I see him waving his hand. Now I see his virtual hand. Alder Tate.
I just want to wish a happy birthday. I'm not going to say which birthday it is, but to our chairwoman of the Finance Personnel Committee, Alder Taft. Dr. Alder Taft celebrated a birthday. Sure, the happy one.
Dr. Alder, happy birthday. Any other announcements? Any other announcements? Seeing none at this time, Alder West, I entertain a motion to adjourn.
Move to adjourn.
Is there a second? Multiple seconds. All those in favor of adjournment, please say aye.
Aye.
Opposed? The motion carries. We are now adjourned. Thank you, everyone.
Good job, everybody.